initiating and leading informed and evidence-based local campaigns in coordination with the DCTs. Resolution 3, TAC will use community-led monitoring data to develop informed and evidence-based.
Whoever's in charge of the screen, can we just keep it rolling up, please? We need to be able to read the resolution.
Kensley.
Thank you.
TAC will use community-led monitoring data to develop informed and evidence-based national level and international level advocacy demands to improve the state of the healthcare system, the HIV and TB response, and access to medicines led by national leadership. Resolution 4, TAC branches must be safe spaces that are open to everyone. TAC will actively fight against the oppressions we see in the organization as well as in wider society, including sexism, patriarchy, gender inequality, homophobia, transphobia, all hate, discrimination, and violence perpetuated towards LGBTQIA community members, sex workers, people who use drugs, xenophobia, racism, classism, and ableism. Resolution 5, TAC will build a mass movement with more than 20,000 active, vocal, and capacitated members in good standing by the next Congress. In order to achieve this mandate, TAC will mobilize in communities, work with local organizations on each other's struggles, participate in community structures, establish new branches near all clinics monitored by TAC staff through Richidze, as well as using online platforms. We'll reach out to public healthcare users, people living with HIV, people with TB, women, young people, LGBTQIA community members, sex workers, people who use drugs, people with disabilities, and migrants to grow the organization. Resolution 6, TAC needs to be even more visible in communities across the country and pay even closer attention to the needs of the communities on the ground. Resolution 7, TAC members need to be ambassadors for TAC at all times. Resolution 8, TAC will support, encourage, and pledge solidarity to other struggles for social justice following consultation with branch members. Resolution 9, TAC will develop strong cadres within TAC membership with the knowledge, skills, commitment, and resources to implement community-led monitoring and local campaigns and understand the latest in science, treatment literacy, health policies, relevant laws, and the overall state of the HIV and TB response and broader healthcare system. Resolution 10, TAC will adopt the modern art approach, rolling out tools, trainings, and social mobilization campaigns to branches, facilities, and communities we work in to ensure the latest treatment literacy information reaches the masses. TAC will seek funding to expand modern art to be led by all branches. Branch-led modern art should focus in communities in which TAC works, including high-burden CBDs. Resolution 11, TAC will explore ways to expand treatment literacy for people with disabilities, including through the use of sign language. Resolution 12, TAC will implement a radical program of cadreship development to take place to build a second and third layer of leadership within the organization.
Thank you, Comrade Lottie. So just for comrades who are from partner organizations, just quickly, so you know the process. These resolutions are found in the, first of all, found in the TAC National Congress document as draft resolutions. They were discussed for about 3 hours in commissions yesterday, in 5 commissions. And there was then a plenary session where each of the commissions reported back to plenary on the discussions that took place. That was captured overnight by comrades Bhutto and Lottie and other comrades, I think, into the resolutions that you see presented to you. So they've been extensively discussed up to now. Now to the delegates of the TAC provinces, I just want to ask you, if you only to speak if there is a resolution that you disagree with or that you want to be amended, or if there is a resolution that should be here that is not here. Okay, and we will note those down. But if comrades are in agreement, we will go through each section. Then I will ask us just to vote to endorse the resolution on that section that is before us. So can I ask, and if comrades, I don't want speeches in this, if comrades have a comment or a suggestion, please be as precise and specific as possible in what you are proposing, objecting to, recommending, okay? And about the particular resolution that you are talking to. I saw Gauteng.
Okay. No, thank you, man. It's not a proposal for change or decline of what. I just wanted to advise the scribers that more resolution 5, I saw that they wrote LGBTQIA plus community. And I think we have resolved that we are going to use key population. So I just advise that we change wording on that. Apart from that, all is well.
Thank you. Comrades, I think that has been a decision of TAC already, am I correct?
Yes, we just expanded it out to include each of the key populations.
Okay, so you can put LGBTQI plus stroke key populations or whatever. Thank you, comrades from Gauteng. Is there any other, that was very helpful, focused, precise, any other comments? If not, I want to, any objections to this resolution? Any amendments, any other amendments? Can I see support in terms of hands from comrades who adopt and endorse this first part of the resolution? I don't know, are we doing it by province or are we doing it by all hands? Comrades, I need advice. By province. Okay, I see Limpopo support, I see Gauteng, I see Eastern Cape, I see Western Cape, Free State, and Mpumalanga. Have I left anybody out? Northwest, I didn't see Northwest. Sorry, Northwest doesn't vote. Thank you for clarity. So the first part of this resolution, what's the title of the resolution? Building local engagement and activism is adopted by this Congress unanimously with one textual amendment. Thank you. We move on to the second. Well done, comrades.
Good morning, comrades. So now we move on to the broken public health care system. There are 3, if not 4, resolutions on this part. So resolution number 13, TAC will continue to use community-led monitoring to document and expose health system crises at a local level in order to turn around the situation in the public healthcare sector. Resolution 14 says, TAC considers the funding situation and the shortage of healthcare workers in the public sector to constitute a crisis that requires an urgent response. We will work with partner organizations to address this crisis through seeking adequate resourcing for health and optimal expenditure of finances. Resolution number 15, TAC considers the time that it takes for ambulances to arrive, if they arrive at all, to be morally unacceptable. We will double our efforts to campaign to improve the reliability and availability of emergency medical services in the country. Yeah, those are the only 3 on that section.
Okay, it seems like the public health system is good and strong. Only 3 resolutions. Comrades, okay, so we're going to first of all take, again, amendments or additions, and then we will vote. Comrade Sibongile. It's still almost morning. Mike?
Okay, I think I got it. So, comrades, I think I have an addition on this. I think we're talking about NHI, if I'm not missing it. We are still on building local activism.
Still to come.
NHI
But
is
I think it belongs here, what I want to talk about, because we are considering to strengthen healthcare system. So I think we need to put a resolution to say TAC, I think we spoke about on the first day, to say TAC is denouncing the medical xenophobia that is happening in this country and will continue to fight against it.
Thank you, Comrade Sibongile. Comrades, so that's a proposed addition. It'll either fit here or somewhere. That TAC denounces medical xenophobia that is happening in our country, because we've always held that the right to health exists without borders. Comrades from provinces, wave your flag if there's... If there's Lottie says there's a whole section on that. Okay, so that's noted. I'm not going to ask for that. Are there any other additions or amendments? Do I see a hand at the very back? Yeah, speak.
Good day, colleagues. For me, the issue of ambulances, I think we need to go a step further when you talk about it, because the issue was, one, the availability of ambulances, but two, the issue of the quality of the ambulances themselves. Because in some instances they are there, but they are not
Equipped.
the right ambulances for the environment. So you get given a combi instead of a 4x4. So we need to be clear about that. And also the equitable distribution of those ambulances, because the ambulances in some instances are there, but there's not enough staff. So we need to figure out how do we deal with that issue. Because one of the things that came out was that in Gauteng, for an example, there's 1,080 ambulances, but only 300 are working. So what does that mean?
Thank you, Comrade Noma. Okay, comrades, do I see any other hands? Otherwise, I'm moving towards a vote on these resolutions on the public healthcare system. We have a significant amendment from Comrade Noma, and the issue of xenophobia, which will be covered in a later resolution. Can I see comrades who are in support of this section of the resolutions? Provinces, please. Eastern Cape, Mpumalanga, Limpopo, Free State, Western Cape, KZN, Gauteng, KZN, are you supporting? Yes, KZN. Okay, so again, this report, this part of the resolutions is endorsed unanimously. Thank you.
Thank you, comrades. Okay, the next section is on the National Health Insurance, NHI. So resolution number 16 says, TAC supports the establishment of a universal health coverage system in South Africa that aims to make healthcare funding more equal and accessible to all, underpins the values of life, dignity, social solidarity, and risk sharing that TAC fully believes in and supports. TAC considers a progressive and effectively structured and implemented NHI system to be essential to the achievement of UHC in South Africa in the medium to long term. We maintain that the NHI does not achieve this objective in its current guise. We will continue advocating for an inclusive system that protects the most vulnerable and/or marginalized. TAC will continue to work closely with like-minded organizations to achieve these objectives. Okay, our resolution number 17, TAC will continue informing our members about the details of the proposed NHI system and monitor its implementation and progress at a local level. Progress will be reported upwards from branches to ensure that we have a clear picture of the state of NHI implementation across the country to inform our advocacy. Resolution 18, while stressing our position supporting UHC, should the NHI lead to lack of access to healthcare for marginalized and vulnerable populations, TAC will consider taking legal steps to ensure that the right to healthcare for all enshrined in the Constitution is protected.
Thank you, comrades. National health insurance. That's the section on national health insurance. Any additions or amendments to the text that was presented to us? Very important TAC position going forward because the NHI bill will be adopted by Parliament any day now. I see one hand at the back. Noma, when comrades want to speak, please make sure that you're ready to move quickly to the microphone.
Thanks, Mark. I think this is linked to the issue of NHI because the NHI is not yet in place. And the question is, how do we start looking at financing at the moment? And how do we do the advocacy on some of the things that might be in the NHI or outside the NHI and advocate for the financing of those areas in the meantime before the NHI becomes effective. So we need to add something that talks to the now.
Do you have a suggestion? Because I want comrades to make proposals so that we are able to say yes or no.
No, advocacy for financing the public healthcare system, and then we identify the areas that we want specifically. For an example, we talked about the issue of shortage of nurses, shortage of staff, not just nurses, but technical staff and a simple thing like your drivers for the ambulances, because in some instances you've got the ambulances, but there are no drivers. So how do we start financing those things? And also one of the issues is the exodus from the public health to private health. How do we deal with that issue in terms of like ensuring that we retain staff by having certain programs within the public healthcare system?
Okay, comrades Lottie and Bhutto, do you have any suggestion or response? Does this come up later in resolutions or?
I would say that it's covered in Resolution 14 and Resolution 19. Resolution 14 is talking about the funding situation and the shortage of healthcare workers to constitute a crisis needing urgent response, and we'll work with partner organizations to address that through seeking adequate resourcing for health. And 19 is around budget justice, which we're coming to next.
Okay, Noma, are you covered? Okay, so Noma, you're covered, but I'm just going to ask you as we go through this to again, just look if there's a way of strengthening formulations around necessary financing, not just of NHI, which is at the moment just a bill, but of the platform of health services and of the human resource base of healthcare services. You're covered, Noma, yeah? Okay, Noma's covered. I don't see any other hands, so I'm asking, again, provinces, support? If I don't see, okay, in future what I'm going to do is I'm going to ask if provinces, any provinces that oppose a resolution, and then we'll be able to see more quickly. Okay, that part of the resolution is supported. Thank you, comrades from provinces.
Okay, thank you, Comrade Mark. And then we move on to number 19, which you've just touched on a little bit. Resolution 19 says, TAC will engage in advocacy to challenge the austerity budget that does not do enough to prioritize the rights of people in the country and public healthcare users. That's the only one on budget justice.
Any opposition to a resolution that says that TAC will campaign against austerity? Any provinces opposing that? The resolution is supported.
Okay. The next section is on art collection. Resolution 20, TAC supports 12 monthly prescriptions and the rapid rollout of 3 and then 6 months supply of ARVs to reduce unnecessary burdens on people living with HIV and the health system. 21, TAC supports more people living with HIV being offered and voluntarily enrolled into repeat prescription collection strategies, including external pickup points, facility pickup points, and adherence clubs that suit their needs. 22, TAC supports the re-establishment, revitalization, and widespread rollout of functional adherence clubs managed through provincial health departments that provide a space for art collection, peer support, and the provision of treatment literacy information for people living with HIV who choose to join this model. 23, TAC will advocate for strengthening of community home delivery models for HIV treatment and treatment for comorbidities for older people living with HIV and people with disabilities.
Thank you, Comrade Lottie. Any additions or amendments to those key resolutions about access to antiretroviral therapy, TAC's core business? No additions, no amendments. Any comrades from Gauteng?
Yeah, thank you. I just wanted to check because as much as we would want to advocate for prescription of 12 months, 3 months, and 6 months, and so forth, the issue of mental health is very important because we need to ensure that comrades or activists or clients or patients adhere to the treatment so that we're able to can have viral suppression. So I wanted to check if we are able to can maybe amend on that resolution to put that we ensure that there is more effective psychosocial support for all the patients who are taking ARVs. Thanks.
Thank you, Comrades Gauteng. I think that's a very important addition. I don't think it's controversial. Access to mental health care services, psychosocial support. I think it may be something that can be added to number 22.
It's coming up in a further section.
And it's also coming up in a further section. So Gauteng, you're noted. It's noted here. I don't think there's a problem if there's some repetition in resolutions if it reinforces an important point. Okay, any opposition to this part of the resolutions? Okay, this part of the resolutions is supported. Moving on.
Okay, art continuity, 24. TAC believes that all people living with HIV starting or restarting treatment should be treated with dignity and respect. People returning to care should be treated with compassion to ensure that they can restart treatment easily without being shouted at or sent to the back of the queue. We will push for proper implementation of the National Department of Health's adherence guidelines and their Welcome Back campaign strategy. Resolution 25, no one should be sent away without ARVs because they do not have a transfer letter or identity document. TAC commits to monitor and expose cases where people are sent away empty-handed based on these reasons.
Thank you very much. Lottie, any amendments or additions to those two resolutions? Any opposition to those two resolutions? The resolutions are passed.
Psychosocial support as well. Okay, so on psychosocial support for people living with HIV and TB, 26, TAC commits to activism to ensure that a full package of psychosocial support for people living with HIV and people with TB is available at all facilities, including provision of individualized quality assured counseling, peer-led patient navigators acting as a bridge between clinicians and patients, map networks of referral services, optional HIV or TB support groups, and food parcels. Community models of support must be strengthened alongside multi-month dispensing and external pickup points.
Thank you, comrades. Any additions or amendments? Gauteng, this is the whole resolution dealing with psychosocial support. Any additions, amendments, objection? Resolution is passed.
Okay. On AIDS and cryptococcal meningitis, 27, TAC commits to advocacy to improve access to point-of-care CD4 testing with same-day results at all public health facilities to ensure that people living with HIV presenting to care with advanced HIV are able to quickly get the treatment and care needed. 28, TAC commits to advocacy to push for the rapid registration of rollout of newer, better treatments for cryptococcal meningitis, including flucytosine and LAM-B. 29, TAC will build the capacity of branches and communities to better understand the available diagnostic tools and treatments for cryptococcal meningitis to support demand creation and advocacy efforts.
Comrades, any additions or amendments? For partners or media, cryptococcal meningitis is being identified here because it's a cause of morbidity and mortality in people with AIDS and the need for better medicines than we campaigned for many years ago. Any additions or amendments? No? Any objections? The resolution is passed.
Okay, and then on tuberculosis, resolution number 30, TAC commits to advocacy to ensure the implementation of targeted universal TB testing that gives everyone at high risk of TB a TB test in all public health facilities. This includes the use of point-of-care TB lab testing with same-day results and rapid molecular testing in order to find and treat more people who have TB earlier to reduce TB deaths. Resolution 31, TAC believes that community healthcare workers are integral to the TB response. TAC will continue to advocate for enough CHWs to be hired to work in our communities with the equipment, training, and support they need to find undiagnosed people with TB. We recognize, however, that labor struggles are not our core work and must not be led by us, but by organizations or labor unions that specifically represent community healthcare workers. Number 32, TAC commits to advocacy to ensure that newer and better TB preventative therapy, 3HP, is urgently rolled out in the country and to ensure that rapid adoption of guidelines and policies support this rollout. Number 33, TAC believes that all public health facilities should follow a checklist of 6 basic steps to ensure adequate TB infection control measures are in place. We will monitor to ensure that this is happening and take action when not. Number 34, TAC commits to advocacy to ensure that all healthcare workers provide accurate and easily understandable information on HIV and TB treatment adherence through consultations, counseling, outreach, and health talks at all public health facilities. This must include explanations on the benefits of an undetectable viral load on people's own health and on transmission.
Thank you. Set of important resolutions on TB. Comrades need to pay attention because TB is such a big killer still in our country. It doesn't need to be. Is there anything that needs amendment? Is there anything that needs addition to these resolutions? Are these resolutions sufficient to carry us forward and to guide us on the question of tuberculosis? Comrade Sharon.
Amandla. Comrades, I'm not sure if this comes in later resolutions, but we were chatting outside about how there's a lost opportunity of dealing with TB in the COVID context and infection control. And how can we ensure that this infection control measures continue, taking into account the spread of TB and reducing the rate of new infections of TB as well. So I don't know if it comes up later.
Comrade Lottie or anybody who was in the commission, is that an issue that was addressed? Is it an issue that we can benefit with a line that just says that the measures that were adopted during COVID-19 to limit the transmission of airborne infections have continued benefit when it comes to tuberculosis, and that TAC should continue to advocate for health prevention measures for airborne virally transmitted diseases?
Yes. And I would also say, I think lacking on this, we can broaden it. It's not just about public health facilities, and there's a role for TAC to play in ensuring taxis continue to have windows open and so forth. So we can just wordsmith this one afterwards.
Thank you. Okay, any other amendments on TB? Comrade Russell from Rural Health Advocacy Project.
Good morning, comrades. I think with TB, as with most things in the health system, I think we have to add the accountability component to it. You know, a lot of TB successes or failures happen at the facility level, and improve governance and improve accountability should also, I would add, as one of the key demands that we should be adding to this particular resolution. Thank you. Over.
Comrades, did everybody hear that? So how do we build in something to reflect governance and accountability, particularly at facility level around tuberculosis? I see Lottie is typing, so that is noted. I think that it's agreed to by Congress. Thank you, Russell. Any other points? One, and then Sibongile.
So Lynn Wilkinson from the International AIDS Society. I think just to add on to Russell's, perhaps into that, is one of the things we're struggling with in primary health care is that we're not doing lambs for everybody under 200, or even if we said under 100. We're only doing it if they're symptomatic. This is a guideline issue, and what it is resulting in is that nobody's getting a lamb, and therefore we're not diagnosing TB for our under 100 advanced HIV disease patients. So making sure that lamb is accessible and utilized at primary healthcare is really becoming critical.
Thank you, Comrade Lynn. So I think that's, again, a very helpful addition, making sure that lamb is accessible and utilized and routinely offered at primary healthcare level is another addition to the TB resolution. Sibongile.
On the issues of TB, comrades, I think this Congress needs also to take a resolution to say we'll continue to do the monitoring like we used to do in terms of doing the survey on how. I know that it's also reflecting on Richard, but I think it will be better also to come out loud on the resolutions in the issue of TB monitoring and using its data to continue to advocate.
Thank you, Comrade Sibongile. That will be added. I don't see any reference in this resolutions to the TB recovery plan that TAC fought for. Am I right? Can I just say, if that's something that we are monitoring, that we fought for, that we have to keep on the agenda and to continue to fight for? It was mentioned yesterday. So if comrades can add that. Any other additions or amendments? If there's no additions or amendments, can I request any objections to the resolution on tuberculosis? If no objections, then the resolution on tuberculosis is unanimously supported by the TAC Congress. Thank you.
Okay. On key populations, TAC considers it morally unacceptable and a violation of constitutional rights that key populations, including LGBTQIA communities, people who use drugs, and sex workers, are disrespected, humiliated, and dehumanized at public health facilities. We're committed to activism that will ensure the provision of safe, friendly, welcoming, and confidential services at all health facilities. 36, TAC considers it unacceptable that key population-specific services are only available in a few places across the country. We consider it unacceptable that PEPFAR and the National Department of Health think one center of excellence per province can fix the situation. TAC is committed to activism that will actually improve the availability and accessibility of quality KP-specific services closer to where people actually live and work. This includes by demanding the establishment of at least 2 public health facilities per district to be designated to provide friendly and specialized services per key population group, with planned patient transport or transport resources made available for key populations to actually uptake those services. 37. TAC commits to ensuring justice for key populations within our organization at all levels, from national to branch level. We will actively fight against homophobia, transphobia, and all other stigma, discrimination, and hate perpetuated towards LGBTQIA community members, people who use drugs, and sex workers in the organization. Equality will be reflected in all our activities and campaigns, ensuring visible representation and meaningful engagement of key populations, from the planning of our campaigns to the agendas of our meetings to the front lines of our marches. 38. All TAC leaders, branches, and staff at all levels, including TAC national, provincial, branch working committees, TAC branch members, TAC management, and TAC staff members, should be regularly sensitized on issues related to LGBTQIA communities, people who use drugs, and sex workers, to ensure a safe and friendly environment for key populations part of the organization, and to support broader work with key populations in our communities. TAC will develop an internal system to ensure that key populations within the organization are able to safely and confidentially report any discrimination internally to be swiftly dealt with. 39. TAC commits to social mobilization campaigns and other community education efforts to sensitize the communities we work in on issues related to LGBTQIA communities, people who use drugs, and sex workers. TAC members, leaders, and staff will actively fight against homophobia, transphobia, and all other discrimination, hate, and violence towards LGBTQIA community members. TAC members, leaders, and staff will actively fight against the stigma, violence, harassment, and abuse of sex workers and people who use drugs. Step 40, TAC commits to advocacy to push for the availability of adequate numbers of condom-compatible lubricants, male and female condoms, dental dams, and finger cuts at all public health facilities, and in spaces that are private and easily accessible. Sorry, I'm distracting myself. 41, TAC commits to advocacy to ensure that harm reduction services, including medically assisted treatment such as methadone and other drug dependence treatment, are made available at public health facilities. Where people who use drugs need specialized care from a drop-in center or a public health facility offering specialized care, they should be provided with easy referral and adequate resources, including planned patient transport or money for transport to uptake those services. 42, TAC commits to advocacy to ensure that trans people are able to access hormone therapy and gender-affirming services closer to home. Where trans people need specialized care from a drop-in center or public health facility offering specialized care, they should be provided with easy referral, adequate resources to uptake those services. The prep one is coming for people who think I've missed off prep.
Thank you, comrades. A very important set of resolutions on key populations. Adopting it will be a responsibility for all of TAC, but in particular for the key populations sector. This is your mandate. Are there any additions, amendments to what has been proposed here? Lucky boy, I can see you. And somebody else at the back. So 2 comrades quickly, additions or amendments. While they're coming up, can I just ask the Secretariat that make sure you inform me when the Minister is here and ready to be brought in to address the TAC conference. I can't tell otherwise. Comrade Lucky Boy.
All right. For me, it's just a suggestion for a change of phrasing. I think it's 41 where it talks about condoms. Can you check Lottie? Where it says male and female condoms. I think the wording there has to be changed to internal and external condoms. Thank you.
Okay, that's accepted. Internal and external condoms as opposed to male and female condoms. Thank you, Lucky Boy. Yes, comrade?
Thanks, Mark. Since we are advocating for access to quality and affordable medicine, my point is dealing with transgender and the sort of issue of hormonal therapy. So if people there's a high cost of doing that process. It delays, takes time in such a way that when people are in need of it, they decide not to do it. So can we just make something about it?
Do you have a formulation, comrade, a proposal? Lottie, Butto, are you clear what's being requested?
I think so. You're talking about, like, in addition to the service being available at specific sites and being more easily accessible closer to home, there needs to be a kind of easier, speedier process so that healthcare workers at a regular facility level would know about those services to be able to easily refer, so that process can start quicker than currently the long, drawn-out process is taking.
Sure.
Okay.
Thank you.
Accepted. Thank you. That was accepted. Are the resolutions strong enough on the internal campaigns that TAC must wage around stigma and around understanding of key populations? That came up yesterday. Is that strong enough in these resolutions?
We hope so. We think so. But
Okay, Butto says we hope so, we think so, but you'll check again to make sure that it is. But that again is responsibility of the sector and the sector leaders to make sure that happens. Any other amendments, additions to this section? Any objections to this part of the resolutions? If there's no objections, Akona?
I think yesterday we spoke, one of the resolutions that we said that we need to make sure that the key props is also included in the structure of TAC, so I'm not sure if it's covered.
Yeah, in the sectors, the constitutional amendments and sectors section, yeah.
Okay, so that's coming, it is covered, and it's coming up, we'll get to it under constitutional amendments. Okay, moving on to PrEP.
PrEP. 43, just one. TAC commits to advocacy to ensure that all facilities actively offer everyone eligible PrEP, including youth, LGBTQIA communities, people who use drugs, sex workers, and all those who want to uptake those services, and that PrEP is made more easily available through 3-month refills and community collection points.
Any additions, amendments? Lynn Wilkinson.
Hi, comrades. I think we can make this a little bit more detailed. I think it's very important that from the get-go we ensure that we use the same differentiated service delivery mechanisms, the external pickup points, the internal pickup points, etc., to be able to also provide our PrEP options, and that we should make sure that we also want the various different PrEP options available as quickly as possible in this country. So, we should be wanting oral, the vaginal rings, as well as the injectable, so that people have options. And we need to make sure that when they bring the injectable into South Africa, that we don't over-medicalize, which we're very good at, over-medicalize, so that we can make sure that people can get a repeat injection off-site, not necessarily having to attend a clinical consultation for their repeat injectable. And then just an additional, one last thing, sorry, just on oral injectable. And then a big issue in South Africa at the moment is that we're only allowing NIMART nurses to prescribe PrEP. This is a big constraint because we don't have enough NIMART nurses. And if we want to roll out PrEP within antenatal services, which is already policy, then we need our antenatal nurses to be able to prescribe PrEP. And so we need to make sure that all nurses in South Africa do not need NIMART training. They can be orientated on PrEP and they can script PrEP immediately so that we don't reduce access to PrEP.
Thank you very much. Very important additions to the resolution. Okay, comrades, it's time to vote on this one. With the additions that have been suggested, any objections to this resolution? If there's no, Eastern Cape?
Western Cape.
Western Cape.
Molen, comrades. I wanted to speak on age restrictions from getting PrEP for my youth clinics. What happens is when you are over the age of 24, they transfer you to the main clinic, which is one of the reasons we PrEP, we default from taking PrEP. So I think we must advocate for age restriction.
Thank you, comrades. Another important addition to the resolution. Thank you, comrade from the Western Cape, for raising that point. It's not an objection, it's an addition. Can we now take this comprehensive resolution and are there any objections to it? Okay, resolution 43 on pre-exposure prophylaxis is supported unanimously by the Congress. On aging with HIV.
Okay, so on aging with HIV, there are two resolutions. Resolution number 1, which is resolution 44, TAC commits to advocacy to ensure that all people living with HIV, including older populations, can access treatment and care for comorbidities within repeat prescription collection strategies. Resolution number 45, TAC commits to advocacy to push for healthcare providers to target older people with HIV prevention and testing interventions to prevent late diagnosis of HIV when people already have advanced HIV. Yeah.
Thank you very much. Comrades, resolution 44, 45, on aging with HIV, any additions? Any amendments? Any objections? The resolution is passed unanimously. Comrades, the Minister is due to arrive, I'm told, in 5 minutes. So we will keep going through the resolutions. When the Minister arrives, I will ask him to take his seat here and introduce him to the Congress. Bhutto, continue.
Okay, on migrants, stateless persons, and transient populations, resolution number 46, TAC supports Section 27 of the South African Constitution, which affords everyone the right to have access to healthcare services, including reproductive services. This includes migrants, stateless persons, and transient populations. TAC commits to advocacy to support this right. Then resolution number 47, TAC will actively fight against xenophobia and the discrimination of migrants in our organization and in wider society to commit to assist in conscientizing people both internally and externally on the shared plight of poor and marginalized peoples.
Thank you, comrades. A very, very important resolution given what is happening in our society at the moment. I saw reports this morning about Operation Dudula blocking people from getting access to Califong Hospital. I've seen reports about the same happening in hospitals in Pretoria, Ga-Rankuwa, and then we have the disgraceful conduct of the MEC for Health in Limpopo, Poppy Ramathuba. Are there any additions or amendments to this resolution? Is the resolution strong enough in expressing our total opposition to medical xenophobia? Any additions, amendments? No additions or amendments? Comrade Sharon, you working on this area, are you happy? Does this say everything that needs to be said?
I would like to propose that TAC commits to joining mass movements that are fighting xenophobia in our country, but also to commit that the branches need to mobilize protests against xenophobia and bodies like Operation Dudula.
Thank you, Comrade Sharon. Any seconders for that proposal that TAC join and support movements campaigning against xenophobia and participate in demonstrations? Comrade Anele? Do you want to speak? Seconded. Seconded by Comrade Anele as an additional substantive resolution. Comrades, any objections to this resolution? If there's no objections to the resolution, then the resolution is passed unanimously, and I will ask that the Minister of Health be brought into the room so that I can introduce him to the Congress. Thanks. Thank you. Do you want to go, Sibongile, and just hold his hand? Comrades, we have been joined by the Minister of Health, Dr. Joe Partler. I would like to welcome the Honorable Minister of Health to the Treatment Action Campaign's 7th National Congress. We are very happy to have you here today, Minister. We know that you have been an activist for many, many more years than all of us here, fighting for the right to health, both before 1994 and after 1994, and we salute you for your activism and for your commitment to the right of health for everybody in South Africa, and we are very honored that you have made time to come and join this 7th Congress of the Treatment Action Campaign. Thank you very much. Before I invite you up here, Minister, I'd just like to say a few words to just put you in the picture. This is, as I said, the 7th Congress of the TAC. The first Congress was in 2000 in Soweto at a very different time in the struggle around HIV to the time now. We have comrades here from 8 provinces of the Treatment Action Campaign, and I believe from more than 200 branches of the TAC around the country. We also have our allies from the Rural Health Advocacy Project, from Lawyers for Human Rights, from the International AIDS Society. I hope I'm not leaving out other people. We also have international allies from a number of countries who are watching this Congress by live stream. We have been debating, or the comrades have been debating for 2 days, resolutions that will define TAC's agenda for the next years until the next TAC Congress. And we will give you those resolutions at the end of this Congress and hope that they will be taken seriously and responded to by the Department of Health and by the Ministry of Health. As the Comrade Minister knows, the Treatment Action Campaign is proud to be the best allies of the Department of Health when it does the right thing and fights for rights of health for people. But we also are the fiercest critics of the Department of Health and the Ministry of Health and the government when we think it fails poor people in ensuring that people have their right of access to healthcare services. A few minutes before you arrived, the last resolution that we were debating and passed unanimously was a resolution making it very clear that the TAC is opposed to medical xenophobia and to actions that seek to block people from their right of access to healthcare services in this country. And that is something that we believe that health is a right, and we believe that we are all Africans in this country, and we do not accept colonial boundaries as barriers of access to healthcare services. But that was just one resolution, and you will hear many more. Comrade Minister, we are very happy to have you here. I'd ask the Congress to greet you as you come up and take the stage with a song, and we will then listen to your presentation. Thank you, Comrade Minister.
Wayethi nomsizi Dube, wayethi nomsizi Dube, hasina mala sina lutho. Awusukuma ngizwe. Hasina mala sina lutho, hasina mala sisebenzi. Wayethi nomsizi Dube, wayethi nomsizi Dube, wayethi nomsizi Dube, hasina mala sisebenzi. Ale imali, imali. Tula man. Hasina imali, imali. Au. Imali, imali. Wayethi nomsizi Dube, hasina mala sisebenzi. Wayethi nomsizi Dube. Ha! Hasina mala sina lutho, imali, imali, oh, imali, imali, hamba man, hasina, imali, imali, oh, imali, imali, wayethi nomsizi Dube, hasina mala sise, esandleni, hasina mala sina lutho. Hasina mala sisebenzi, imali, imali, hawu, imali, 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 hawu, imali, imali. Howeshi lumsizi Dube, hamba man, hasina mala sisebenzi, siyaphambili, hasina mala sina lutho. Hasina mala sisebenzi, imali, 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 hawu, imali, imali. Wayeshilo msizithubi, hawu, asenamala sisebenzi, asenamala sinalutho, asenamala sisebenzi. Imali, 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 imali. Wayeshilo msizithubi, asam, asenamala sisebenzi, asenamala sinalutho, asenamala sisebenzi.
Thank you, comrade.
Imali, imali, asam, imali, imali. House, imali, imali.
Thank you, comrades. Thank you.
Imali, imali. Wayeshilo msizithubi, asenamala sinalutho. Wayeshilo msizithubi, asenamala sisebenzi.
Thank you, comrades. Thank you.
Amandla! Amandla! Viva Treatment Action Campaign, viva! Viva Babu Patla, viva! Matla! Matla! Aruna! Aruna! Matimba! Aina! All the power! All the power! Qina TAC, qina! Qina TAC, qina! Amandla!
Thank you, comrades. I just want to acknowledge before the minister starts his address that our chair of the TAC Board of Directors, Dr. Farid Abdullah, has also joined the meeting now. Welcome, Comrade Farid. Minister, thank you very much. Over to you.
Thank you very much. Thank you. Thank you very much, Mark. Thank you, and greetings also to my comrade and colleague, Dr. Farid Abdullah. And thank you for the welcome song. I'm sure Farid will tell you that this kind of song takes us way backward to very fond memories of our youth and activism. The late Msizi Dube was one of our leaders of community struggles and political struggles, ANC, UDF. In fact, before even the birth of the UDF, but the founding structures of which later on constituted in 1983, what became the UDF. Comrade Msizi Dube was a leader of the civic organization, not far from where me and him were staying, at a place called the Alan Taylor Residence in Durban, next to a very smelly oil refinery. Just, I think, took us about 10, 15 minutes to get to Lamontville, which is where Msizi Dube was the community leader. So as we sing this, it really inspired us when Msizi Dube was taken away from us. Asida Mali was our cry at the time, and I'm really inspired that you're still remembering those icons. Thank you very much for inviting us to come and share with you this very important moment of your 7th National Congress of the TAC. Greetings to all the leaders of the TAC. I was informed that the country director of UNAIDS was also going to speak. I don't know whether she is already left, Ms. Eva Kiwango. Other representatives of various important organizations from the labor movement, the Lawyers for Human Rights. I also learned that they would also be sharing this with yourselves. As a ministry and Department of Health, we don't take this lightly, the invitation for us to come and participate at your Congress. We see this as a gesture of friendship and partnership between yourselves as a very important player in the area in which we are charged with the responsibility to steer the nation towards a better health. So we appreciate this gesture of a partnership and friendship. I can see from the program, as Comrade Bak was saying, that you have had very intensive 2 days, very intensive discussions on wide-ranging topics, also seeing also from the commissions, the topics in the commissions, matters which we were discussing yesterday, which relate to, in the main, the health of our people. And I look forward, Comrade Mark and the leadership, as a ministry, we're looking forward to sharing, that you will be sharing with us the resolutions which will have been adopted. And I must say, the program director, Mark, that I'm not going to be tempted to comment on the last resolution, except just to say that we agree that as a country that we must respect our constitution, that the right to health is enshrined in our constitution. And therefore, the manner in which we treat our people and citizens, permanent residents, and we are guided by law, including international law, in terms of how everybody who's within the borders of South Africa needs to be treated. But we must say at the same time that while we accept that, you know, there is no room for discrimination in the area of when people seek help, we want to also encourage all other authorities, everybody who takes responsibility of their people, wherever they may be. We must take responsibility for our people, for the people of South Africa, and people who are here for all various reasons. But we also expect our colleagues, our friends in the various institutions, right from a municipality to a province, ourselves as national government, but equally so to other people who have accepted responsibility and leadership to provide services to their people, wherever they may have accepted that responsibility, that they must discharge that responsibility so that we can all be able to, you know, live together and cooperate and share resources in an orderly fashion. Because in a situation where there is disorder, then it can only lead to more difficulties in terms of how we provide services to our people. So we're looking forward to future dates where we will be, you know, favored with the decisions and resolutions and opportunity to engage unpacking those resolutions. And because at the end of the day, our view is that we are partners. You operate on a particular platform. You've got a particular responsibility in terms of the mandate of the organization as a civil society organization. You have a particular responsibility, and we have a particular responsibility as an organ of state which is charged by the Constitution with a particular responsibility to provide services. But at the end, we share one common, you know, interest in the sense that both parties want to see South Africans living longer and living healthier, whichever way we might be driving that direction. When both of us ultimately say we have achieved our goal, is when South Africans, as defined in our National Development Plan, more South Africans can live 70 years and beyond and very healthy and a fulfilled life and be able to add to the well-being of society. As a government, it is our responsibility to put in place the policies, the legal framework, and above all, to draw the plans and implement them to make sure that we can improve the quality of life of South Africans. So as an organ of civil society from your side, we accept that your task is making sure that people are aware of their rights as per the Constitution and hold government accountable for the realization of those rights. So in that understanding of the partnership, we see our presence here today as instead cementing that relationship and understanding. So I must say that seeing, the vibrancy here and then a number of people here, it is giving one a lot of hope that indeed the TAC is still alive. And from the singing I can hear the TAC is alive, and is alive and kicking. So we appreciate that, and we wish you all the best as we move forward. So we do appreciate your contribution to the health and well-being of our people over many years. I'm happy to see that veterans like Mark are still here to give the younger people a lot of inspiration. Today, people living with HIV are living healthier and longer than the years which Comrade Mark was talking about of your first Congress. Was it 2000? Yeah, you said 2000. It was difficult times then. A lot of different views from the state in terms of how to respond to the HIV pandemic. But due to your struggles, we are where we are today. Not yet perfect, but a lot of progress has been made over the last 22 years since your first Congress. Now, this Congress also takes place at a very important time in our country, but also in the world. A year ago, we would not have been able to meet like this, as we were still in the grip of the third wave of the COVID-19 pandemic. I remember having a long interview with Mark in his other capacity. And I'm sure he's not here in that capacity of the Daily Maverick. We had a long discussion, and I leave the rest to him because he asked me some questions. As to a year later, how things are, I leave that judgment to him. But we were really in the grip of the COVID-19 third wave of Delta. And we remember, I'm sure all of us, even as now we are more relaxed, we are able to get together in this fashion. As we discuss, I'm sure we remember that over and above the main task which TAC was established to campaign for, there was another pandemic which got into our lives, that COVID-19 pandemic, which is still there, but a little bit more under control. And we lost a number of compatriots, a number of friends, family, colleagues, various leaders of society we lost in that third wave of the pandemic, and other, especially the first and second wave. So we are indeed very pleased that today, as a country, we can be where we are today, where we're able to gather together, because this was a very stressful period where, a kind of a disease where when you are sick, you're isolated, you can't be visited by friends and family, so you die alone in serious, in very depressing loneliness. But at the end, even worse for the families, when the deceased were to be buried, again, a lot of restrictions. So we're indeed very pleased that hopefully we are out of that, and we hope that it doesn't return. So we want to thank the working together of civil society organizations like yourselves, various other. We work very closely with SANAC in terms of promoting the prevention, messages about COVID-19. Business also came to the party in various ways. Labor came to the party through NADLEC and other structures in various activities. The health professionals and health workers in the front line, especially the researchers, came to the party. And at the end, we are where we are because of that, cooperation amongst all role players. And it was as a result of the impact of this cooperation that just around the 22nd of June, just over 2 months ago, we announced the lifting of all restrictions, the wearing of masks, the social distancing, gatherings, that we could all get a semblance of our lives back. And as we were reporting to the country just over 2 weeks ago, there hasn't been any major challenges, in these last 2 months. We have seen cases still going down, stabilizing downwards, no resurgence in terms of hospital admissions, and all the indicators thus far very promising that we're going in the right direction. So we're saying today we want to encourage and acknowledge the solidarity of all South Africans under these very difficult times of the pandemic. We want to nevertheless remind us again that this pandemic is not necessarily yet over. It's still there, it's still lacking. And I must say, I'm also testimony to that, because just over about 4 weeks ago, unexpectedly, I get some sore throat, fever, so on. And I say, hey, let me test. Then it comes back positive. So it was just a reminder that this thing is still there. It might be under control. And because of the vaccination, which we want to again urge South Africans to continue to vaccinate, because of that, one was able to have a mild illness. So we want to again urge people that the vaccines are still there, they are active, they are effective, and they save lives, and many of us are testimony to that. But it is again because of this progress that of the reduction in the impact of COVID-19 that just over 4 weeks ago, some of us and some of you who I can see here now were together in Montreal at the International AIDS Society Conference. First one in person in 4 years. This was also able to happen because of the fact that there's a reduction in the impact of COVID-19. This was a very important gathering, as many of you have been to previous others, where various partners, governments, civil society, researchers, business, pharmaceutical companies come together to come and reassess where we are, and this was really the purpose of that gathering in Montreal, and also to commit ourselves to the eradication of HIV and AIDS as a public threat by 2030. And we rose from that conference committed that indeed we must make sure that this is a reality. And now we're back at home. Our duty now is to implement. We acknowledge that COVID-19 has set us backward in our various targets in as far as the fight against HIV and AIDS and towards 2030 is concerned. While we must accept also that before the advent of COVID-19, we are already struggling to achieve our targets in as far as the 1990 targets of 2020 is concerned, which we have not been able to reach. Only a few districts in our country have come very close. If some few we have already managed. But the COVID-19 has taken us even, and the lockdowns and restrictions have taken us even more backward. So we have now agreed through the SANAC community to work very hard on our recovery plans. Programs such as the Welcome Back campaign, which is acknowledgement that in the process of the pandemic, the COVID-19 pandemic, many people who have already been tested, who are on treatment, have actually regressed in terms of sustaining the treatment. And that's why at the current moment within our 1990, in terms of being on treatment and retaining on treatment is the most regressed in that 1990. At some stage we're even below 80. I think we now bouncing back a little bit around 83%, but it's still not good enough. We need so the comeback campaign is to make sure that many more people who have been lost to treatment can come back. Before we can even talk about many people who don't know their status, who still need to be reached with the message of knowing your status, coming forward to be tested. We must first, concurrently, make sure that those who have lost to treatment needs to be encouraged and to come back to treatment. So the comeback campaign. Now, in terms of that comeback campaign from the department side, we have engaged in a process of training our healthcare workers, frontline healthcare workers in all the 9 provinces, so that they have a very clear understanding of the task and the mandate, so that people are treated with dignity as the campaign is rolled out, and that the issue of stigma should not come back to the surface again. So these training programs have already been rolled out. 3 provinces have already completed their training, which is KZN, Mpumalanga, and Gauteng. And in the next 2 months, we expect that the other 6 provinces will have also completed their training. But this is happening concurrently as the program itself is being rolled out, and you can see a little bit of, encouraging results in terms of more and more people, getting back into treatment. But this is really something which we need to push very hard to achieve. So we also know that there is a lot which we need to do in terms of more people knowing their status and those who are positive being put on treatment. We know that at an estimate, close to 2 million people we still need to find, encouraged to be tested, and because from the estimate of the way our projections are showing, close to 2 million people who are HIV positive have still not been tested so that they can be put on treatment. So the work in terms of all of us working together, back to the ground. Now we can't, we don't have the excuse of COVID-19 that we can't be on the ground, we cannot be campaigning, we cannot be in the communities and mobilizing and making sure that people can be encouraged to come forward and be tested. So, and especially in terms of also indexed testing for contacts of those who have already tested positive. All this really now, it's the struggle ahead of us. We say that, we've made a lot of progress as indicated. Everybody, when you are in this international fora, acknowledge the progress which we have made in terms of the biggest rollout of antiretroviral treatment in the world. But we acknowledge also that in terms of contributing to the eradication of AIDS as a health, international health threat, we have a biggest contribution as a result to make to that, and there's a lot of work which we must still do. And as was shared also during the course of this International AIDS Conference, in the fight against COVID-19, as I said, has pulled us back. But that fight against COVID, that it's sort of contained in just over 2 years, a lot was learned from the experience of the fight against HIV and AIDS. A lot of the strategies which were used in terms of, rolling out community screening, testing, all the community door-to-door campaigns and all that. These were all strategies which we must, we were able to embark on because of the experience in the fight against HIV and AIDS. But now as COVID is more suppressed, we are saying, and that was the message also from the conference, we must take advantage of the lessons which we also learned from COVID. It has pushed us backwards, but we learned, there are a number of things which we learned in that campaign against COVID-19, and we must use those lessons of COVID-19 in terms of making sure that, all of government, bringing government as a whole from local districts and provincial and at the national level, the whole mobilization of government led by the highest office in the land, the whole of society bringing together all role players, the health professionals, the researchers. The fact that, and this is a matter which was quite very prominent in the discussions, the fact that over all these many years, our scientists have not yet been able to achieve one, we have made progress in terms of therapeutics, a lot of improvement in the treatment of HIV and AIDS, but we have not, as yet, from the therapeutic point of view, our scientists and researchers have not been able to find a cure. So that's still a sore point. But also, the fact that our scientists and internationally working together, they were able to find vaccines, even if it's not vaccines which totally prevent COVID-19, but make sure that even if you get infected, it does not lead to serious illness. Why is it, and that was a major issue to say, the fact that this was done, I mean, COVID broke out around, in China, maybe around January of 2020. And already by end of 2020, I mean, by September already vaccines were being tested, August, September. And by the time we reached December, vaccines had already been tested and some were already been confirmed as being safe and effective, just in a period of less than 12 months. With their shortcomings that they don't prevent complete infection, but very effective. The question is, can we leverage on that science? And there are promising indications. Those who are in the research field are telling us that especially the messenger RNA vaccines, that technology has a lot of potential to can be extrapolated beyond COVID into using just the basic science. I've left medical school a long time ago, so I just listened to some of these things and understand some of the basic science, but I'm no expert, but when we were there, Farid, you president of the Medical Research Council, Professor Glenda, was making a presentation, and it was very well attended, huge hall, and you can see the interest of international role players. I think that hall probably took more than, 1,500, and it was packed, because she was presenting about, herself and others, medical science colleagues, about progress which is being made in as far as therapeutics are concerned, various advancement in the area of therapeutics for HIV and AIDS, progress which is being made, and also progress which is being made in the area of vaccines. So those are some of the areas which we are saying in the mobilization, in terms of organizing the sectors, government, the whole of government, whole of society, bringing together the researchers, the business, the labor, all the parties together. We have done that in as far as the fight against HIV and AIDS is concerned, but because of the pressure of COVID, in the manner in which, and COVID, as we all know, it was sort of an equalizer, because granted, if it hit poor people, it makes poverty even deeper because of reducing job opportunities, economic activity, people losing jobs. But in as far as illness and serious illness, clearly when your body is already compromised, it will be worse. But it was sort of an equalizer, and some people say because it was hitting heads of state and top business people, and many passed away as a result. That's why the business world was so quick, mobilizing millions and billions of dollars, pouring them into the research, and vaccines were quickly approved. So we're saying that across all the board, we must make use of all the various strategies which has made us to reach where we are, to push quickly, to recover lost ground, and make sure that we can accelerate our progress in as far as the fight against HIV and AIDS. And we know that key to that, while we have made progress, we are still slower in the area of prevention. There are indicators that there is some progress in as far as new infections, not good enough to actually contribute very decisively to serious slowing down, especially amongst young people. As we all know, the numbers are there to show, especially our young girls, young girls, and young women in that area. We're still not doing well, but youth as a whole, there's still a problem. But so we must continue all our tried and tested in terms of condomizing. The condoms are still there. We must make sure that the promotion of the use of condoms is really accelerated. But of course, as we do that, I hope we don't forget our also, very tried and tested slogans of ABC, abstention and be faithful, but clearly the condoms are very effective. Of course, also the campaign to make sure that those who are vulnerable, we must roll out the pre-exposure prophylactics. And in the conference also, there's very strong message about combination prevention tools, including a very high demand for new instruments, new tools which are available in as far as, for instance, the Pervin vaginal ring, which in our country, SAPRA is already approved. We need to make sure that we can, pull out all our resources as we move forward to make sure that this can be available. Of course, we're still waiting for SAPRA also to approve our long-acting injectable solutions. But also in this area, we must also fight together to reduce the cost, because it's one thing to have something which has got very high promise, but if it comes at a very high cost, then we're not able to achieve that. Of course, on the treatment side, part of what we must take advantage of the COVID period, the multi-month dispensing was proven to be very useful. We had to accelerate that as a result of pressure because, health facilities had to be scaled down and so on. But now if we want to put more people to be on treatment without burdening our health facilities, it means we must really make sure that we can improve in our multi-month dispensing from 3 months, and for those who are very stable, up to 6 months. Our adherence clubs, all those have to be, we have to strengthen them. Key to that also integrated services, because we know already that our frontline health services are very overburdened. So integrated services is also very key as we push this side on infectious disease, non-communicable diseases, but also basic sexual and reproductive health. Part of our experience during the COVID is also that just basic family planning, suffered because, of all the disadvantages in this regard. Now, the other killer also in our midst, of course, is tuberculosis. This is another killer which we need to focus on. We know that as much as a lot of advances also have been made in this area, we lost ground, in terms of adherence to treatment. And we also know the synergistic relationship between HIV and TB. TB is a major opportunistic infectious disease together with other bacterial infections, which leads to serious illness and even death, together with cryptococcal meningitis and other bacterial infections. So the fight against TB also has to be intensified. Within SANAC, we have already approved a recovery plan to claw back the lost ground for screening and diagnosis of TB. In that area, we know that we're still not able to reach up to 150,000 people who, in terms of the analysis, are estimated to be carrying TB, not knowing. So we need to upscale our screening, our testing. We've got the tools in terms of the gene expert, digital x-rays. We need to roll them out and make sure that people know those who are infected, even if it can still be latent, they can be diagnosed and be put on treatment. We've also made some milestones in as far as the preventative therapy for people at risk of tuberculosis. Guidelines have already been approved by the National Health Council in terms of preventative therapy, and this includes also the 3HP prevention therapy. So all this needs to be rolled out to make sure that we can reverse the impact of all these scourges on our people. I just want to mention also that while all this has been happening, one of the key areas which also a neglected non-communicable disease, mental health, has really reared its ugly head. part of it as a result of the pressure of, we know the devastation of COVID. In the community, people, as I've said, losing loved ones, losing colleagues in a very quick way, and in very depressing environment where you can't even do the normal rituals. So that has contributed a lot, but also amongst the health workers, there's also evidence that mental illness, especially depression and anxiety, has really reared its ugly head. And we therefore, as a government, have to roll out a number of efforts, and we're trying to strengthen our mental health capacity intervention in the department. We are pleased that after bidding for some increased funding from the National Treasury, additional funds were made available so that we can be able to also acquire skills which are not residing within the public service. So we're able to contract psychiatrists, psychologists from outside the public service in order to bolster our health facilities. But there's still a lot which needs to be done in this area. But over and above all this, as we were at also at the International International Conference, various commentators, various experts were also acknowledging that the key matter which, developing countries need to be supported is to strengthen our health infrastructure, our health delivery systems. That whether we talk about pandemics, whether we talk about epidemics, whether we talk about endemic diseases, infectious, non-infectious, all this, the only sustainable way is if our basic platform of delivery of services can be stronger. Our infrastructure, our equipment, our human resources especially, and consumables management. I know you are very strong in keeping us, to account whenever there's various stockouts, not only in terms of ARVs, but also other medicines. Now, this is a reflection in terms of capacity that we've got the technology now. There's, one amongst other things which COVID has also accelerated is the use of technology. I mean, suddenly we all had to find ways in terms of contact tracing, electronic vaccination, data systems. And we're saying all these technologies, which some of which have been there, we've been very slow in rolling out just data collection. Because without data, without knowing the numbers, then you are not able to respond. So we acknowledge also the fact that as we deal with all this, we need your support, your cooperation and encouragement and criticism where necessary, where our systems are weak, because we need to strengthen the systems. And that's where also the National Health Insurance comes in, that we must implement the NHI. Currently, as we speak, the bill is in Parliament. The committee is sitting even this afternoon and over the next few days to finalize that clause by clause in the Assembly. So we're looking forward to this as long-term solution. So as I conclude, Program Director, I want to wish you all the best and say that we're looking forward to those resolutions which we have passed, and we're really eagerly awaiting engagement with yourselves in terms of where you are able to advise us in terms of improvement in programs, but also overall in terms of strengthening our health delivery platforms. Thank you very much.
Thank you very much, Dr. Patla, Minister of Health, for a very focused presentation on the challenges that we face in the HIV response and in the health system. It's interesting to hear you talking about the International AIDS Conference and how civil society and scientists and government were at one in representing South Africa's challenges. It reminds me of a very different scenario in 2006 in Toronto, where civil society and government were not at one at all. But that conference contributed to the beginning of our country's move to a response to HIV based upon science, based upon what we know about medicine, and we're very glad that that is still the approach that is taken by yourself and by our government today, and we appreciate the very complicated task and responsibility that you have taken on as Minister of Health. It must be one of the most difficult and demanding portfolios of government. So we value you stepping up, Minister, to do that job. I'm going to now hand over to Sibongile Shabalala, who is the fourth outgoing chairperson of the Treatment Action Campaign, and currently just an ordinary branch member until we finalize our new appointments, elections to the office bearer positions of TAC, which will take place early this afternoon. Comrade Sibongile, I can give you 10 minutes or a few more if needs be to respond on behalf of TAC to Minister Patla. Thank you, Comrade.
Amandla. Amandla. Viva TAC, viva. Thank you, Minister. And I would like to acknowledge our board members who are here, partners, comrades, and the whole delegates of this Congress. I will try to be as calm as I can. And also try to keep time. Thank you, Minister. And we acknowledge the relationship that we have with the National Department of Health. And we really, since you took over, we are seeing a lot of progress, and we want to acknowledge that. But as you said, there is still a lot to be done. And while I'm talking about that, as we are here in this conference, Congress, we've been identifying issues that are affecting us as communities in terms of healthcare system and also in general in the country, to say how do we respond to the issues that are affecting people on the ground, because you cannot separate health from any of our economical status or environment or anything that we are living with on the ground. So, Minister, I would like to start on the issues of medical xenophobia that you said you don't want to engage on, but unfortunately, as the country, we are in the middle of it. We are seeing a lot of violence continuing to happen. And as a human rights activist and a health activist, we are principled to say we are against the medical xenophobia that is happening, and any kind of xenophobia that is happening in South Africa. It is wrong for us as Africans to discriminate against each other. And we are also calling for ministers to speak out about this issue. We are also calling the government to speak out against this issue. It is wrong, Comrade Patla, for us to fight our own. Remember, these borders that are dividing us today were created by apartheid regime. And somebody took a decision to divide Africa. And if we continue to allow people to continue to divide Africa, then it means we don't know when we are saying Azania belongs to people. And when we are saying from Cape to Cairo, from Morocco to Madagascar, we are one. We cannot call Africans illegal in South Africa. They are in Africa. They are in the rightful soil of Africa. So we cannot call them illegal. There is no human being who's illegal. So it is important also to encourage the language that we are using when we are addressing these issues, especially as civil society and government. Comrade Patla, it will be wrong for me not to speak about the issues of obstetric violence that continues to happen in our hospitals. Women's rights are often and every day violated. If we can talk about stories of how women are suffering when they're giving birth on the floors. Few days ago, before coming to this Congress, no, I was here on Saturday. I got a message from one woman who gave birth in Tuberculosis Hospital. A young woman, she was operated with a placenta inside. Is a placenta, Farid, what is this? Yes, in Gubole, I don't know, yes, and she's feeling pain. She had to go and they're not assisting her. So my mandate from tomorrow is to take that woman, take her back to the Tuberculosis and ask questions. So that is one case, but these cases we are getting them every day. So as this is the Women's Month and we are ending Women's Month and we are talking about violence, I think it's important to say that kind of violence that we are less loud about it. We need to be loud about it so that the Department of Health can be able to focus on it also. Comrade Pasha, we know that in South Africa or in all over the world, we have different kinds of people and gender. We know that in South Africa we have key populations, which all of us will acknowledge. But 20% of the key populations that was interviewed between July and August have given up on healthcare system because they feel not welcomed and the services are bad. They face stigma and discrimination from the security guard to the nurse or to the consulting room, regardless of a nurse or a doctor. You spoke much about Welcome Back, which is something that we've been calling for as treatment action campaign and people living with HIV. Between July and August, 22% of people living with HIV who missed their appointments are still turned back to the line. So they are turned back to the queue to wait for everyone, regardless of what time have you arrived to the facility. So as much as there is improvement, but also there still needs more to be done. 16% that were interviewed between July and August, they told us that they have been shouted at by the nurses for missing their appointments. 517 people have been denied services from healthcare facilities because they don't have referral letters. So that also takes me to the question to say, what is the plan on addressing internal migration? Now I'm talking about people moving from one province to another province. We know that in most circumstances, people, they will move around, and when they have to get their treatment, they cannot get their treatment. Is there a plan from the Department of Health to address that issue? Treatment Action Campaign would like to congratulate you and your office in working hard on fighting COVID. Today, we are here not wearing masks. Today, we know that 80% of our population has vaccinated, hence we are here. We know that you didn't do this alone, but you worked with civil society and you worked with us. I know that in other provinces, we were working with clinics to mobilize communities to come and vaccine, and you made sure that vaccines are there. However, Minister, it is important for us to say the relationship that we have with the Department of Health at the national level, it doesn't have to end there, because challenges are not at the national level. Challenges are on the ground. So we will require your intervention, especially when we do advocacy on the ground. In most cases, we are ignored by the MMCs of health, which are not usually taking their responsibilities. The MECs of health, they don't want to take our calls, or we will schedule a meeting and agree on the meeting. On the day of the meeting, then they feel like there is something important than us. So we would like you, Minister, to assist us in responding to that. But while we are doing that, we don't want the relationship that is too formal. Because we believe that when you elect leaders, leaders are elected to lead people, and leaders are elected by people. So leaders need to be accessible to people. So we just want you to be 10 digits away from us. We want just to send you a message and say, Minister, there is a problem here, and you respond to that. You raise the issues of mental health, Minister, which all of us, we acknowledge that is a problem. In the past 2 days, we have also spoke about it at length to say mostly of us as people living with HIV, we are suffering from mental health, and that made us to default to on our treatment or stop taking our treatment for various reasons. And we are seeing more and more of people who are living with HIV being going back to the areas where we have advanced HIV. So as activists, we don't like to use the advanced HIV because it's too nice. So we need to use the word AIDS so that people, they will understand what we are talking about. So we are seeing now people who have AIDS and who are dying from AIDS, while we have made so many interventions. So instead of us going forward, it seems like we are taking 10 steps back. And I'm glad that you spoke about strengthening the mental health. We are going on the ground, we're going to monitor to say these services are there, because in most cases, we hear you politicians and ministers commit on the things, but when we go on the ground, it's not them. Minister, I loved when you encourage us to abstain, be faithful, and condomize. I think you're violating our rights. The right for us to have sexual reproductive health and right. We cannot talk about that in 2022. I think we need to talk about how are we enhancing prevention methods. How do we encourage communities to use PrEP, not only key population, but everyone who's eligible for PrEP needs to be provided with PrEP. We need to provide condoms, lubricants, and all forms of prevention methods, instead of encouraging a person who's sexually active to say abstain. It's not possible. It's very difficult. You have to deal with your mind first. Also, you spoke at length about index testing, which it's very good and we always encourage it, but the Department of Health doesn't consider the violence that is happening after index testing, because based on our data, it shows that most of people who are tested, the nurses or healthcare workers, they require their partners' contacts, and they don't even cancel them to tell them why they are going to call their partners. and some of them have experienced violence because of that. So we need to address that issue also. Before I sit down, Minister, there are two issues that I want to speak about. The issue of, I think there are three, the issue of staff attitude. Yes, it's getting better. We need to acknowledge that. But as for July, August, monitoring that we've been doing, 32% of people that we interviewed are still saying they only get friendliness sometimes in the facility. So that means we need to do more. But also, Minister, talking about TB, and you raised the issue of 3HP. We would like to call the Minister to support the civil society, as you did, as the country did when we were fighting the TRIPS waiver, to say the pricing of 3HP, it will make it impossible for everyone to access it who's eligible to it. So it's upon us, all of us, civil society and government, to fight Big Pharma. Lastly, Minister, I want to talk about the freedom post of healthcare workers. That affects us on the ground. Why? Because we have to wake up early in the morning, around 2, 3, to go to facilities and queue outside the facility. We are putting our lives in danger because we want to live more. And it's not assisting the situation on the ground. It wasn't the situation on the ground, and hence we are seeing more people dying on the ground. And also, Minister, the issue of ambulances. If I'm using the right word, English is not my mother. We always say that. But the issue of emergency services, it has become a pandemic, because every province now is struggling with issues of emergency services, including Gauteng, where we always say it's an economical hub of the country. So we are still facing the issues of emergency services, and people are dying unnecessarily because of that. So, Comrade Pahla, we would like to request you and urge you as a minister to make sure that you deal with corruption within the Department of Health, and you make sure that you don't become corrupt and refrain from being corrupt, because corruption also makes us to suffer. Those millions of rands that are stolen from the public purse, especially the Department of Health, are affecting us on the ground. We are unable to get quality services that are promised by the Constitution. Our rights are violated because of the corruption that is happening. We are dying because there are no necessary equipments in hospitals and clinics. People have to use dirty linen in hospital and be given bread, brown bread, without nothing, so for them to survive. If you don't have a family member, then you are alone. We have seen this happening, especially during COVID, and even last year, mostly in Gauteng hospitals like Helen Joseph and other hospitals. So in that note, thank you very much, Minister. I will pause here. I hope, Comrade Mark, I haven't taken too much time, and I hope I have not been harsh. I try to be as calm as I can. Thank you very much.
Thank you very much, Comrade Sibongile. Before we release the Minister, I'm sticking to the agenda of today. And I see the agenda says also questions and discussion. So Sibongile has summed up for TAC some of the issues that concern us. But I'm going to just allow 10 minutes for contributions from the floor on issues that comrades want the minister to hear from your experience and from TAC. And then, if the minister wants it, I'll ask the minister if he wants to say any closing words just in response. But I ask comrades, not long speeches, please, to the point, quickly. I'm seeing Eastern Cape, I'm seeing Gauteng, I'm seeing Limpopo. So that's the first. I'm seeing Mpumalanga. That's 4 comrades, 4 provinces that I'm seeing. Can comrades, please, who are going to speak from those provinces, line up at the microphone so we don't waste time? We can go quickly from one speaker to the next speaker. And then please, comrades, introduce yourself to the minister, what province you're from, etc., when you speak. Okay? And I'm allowing 10 minutes for these inputs before the minister. Thank you.
Oh, thank you, Chair. My name is Vuyani Brendi. I'm from the province of the Eastern Cape. I've got 1 or 2 questions to the minister. One, it is not a secret that Aspen in Gqeberha is closing its vaccine plant.
Sorry, I just want to make sure Minister was just consulting. I want to make sure the Minister hears the questions. Yeah, start again, comrade. Yeah, Aspen, Gqeberha.
Yes, I'm saying, Chair, it is no secret that Aspen there in Gqeberha and Eastern Cape, it's closing its vaccination plant because of the vaccine that government promised that it will be distributed in Africa is not being bought by African countries. That is one, Chair. I just want to check from the minister, what is the government turnaround strategy around that? Because that is it's a waste of money which has gone down the drain. Number 2, I'm further aware, Chair, that 92,000 Pfizer doses were destroyed at the end of March.
Microphone, that microphone went off, whoever's in charge of it. Continue.
What is your turnaround strategy again around the issue of ensuring that you don't acquire such loss again of destroying Pfizer?
Thank you.
And intimidate talent.
Okay, comrade, we got your 2 questions.
Yes, I just want to check what is the turnaround strategy of Department of Health around the issue of vaccine which is being destroyed because it has expired. Okay, it's fine. Let me move on. Lastly, Chair, what maybe my statistics are outdated because I will be contrary to what Comrade Sibongile have said. To my understanding, it is that government have not reached 70% of people who have vaccine in South Africa. That is my understanding. Maybe it is outdated. But in that spirit, Chair, I would love to land with a quote from Utata Mandela, which says, "It always seems impossible until it's done." Thank you, Chair.
Thank you, comrade. Now moving to the comrade at the microphone at the back. There's no microphone. Okay, front, Limpopo. Yes.
Avuxeni Minister. Lo avulavulaka I Marvelous Makhuvele kusuka eLimpopo, Deputy Chairperson ya Limpopo Province TAC, Magangeni branch around Elim. My question goes like this, and don't mind me, Minister, You know, sometimes this English must escape my mind, but I have to talk. I want to ask to you, Minister, if or the community or they write some about Salama Papile, do we entertain them now? Because now I'm talking about Elim Hospital. STAC went there twice. Went there to picket, and then last year went there for a sit-in about the same issue. Elim Hospital is dying. And if I know, if I may ask you, you know that that hospital is a historical hospital, but it is dying. You know, nowadays they are removing machines, each and everything. They started by the machines, the laundry machines. At Elim Hospital, if you can go and be admitted, you will stay with that dress. Imagine me as a woman giving birth, full of blood in my dress, for the whole week until I got discharged. No clothes to change. Even the blood cans, they are shortage because they took the machine, they took the machine to another hospital there. And I know you know this issue. This issue that is happening at our area, it's like those who are on lead, they favor their own culture, their own and then what about in our Tsonga? Elim Hospital is based on our Tsonga, and that hospital, it's cater the whole Hlanganan area. You know, comrade, Elim Hospital was the biggest hospitals around our area. Later, eye department at our area. But they remove the machines, they're removing everything. It's like 6 years. We went there and they show us the plan. They show us that Elim Hospital have got the budget. If I can tell you, comrade, even last year when we got there, they even show us the plan. Mara, those other hospitals, they are busy upgrading. And that means what they were saying, that they need to downgrade that hospital to the district hospital. As their plan is going up. Minister, please, what comrade former chair said, that fear the Lord. Because the Lord has said, I will punish the kids because of the sins of their parents. So I don't want your kids and your grandkids to suffer. Please look this issue of Elim Hospital. And then number two, as around there, this issue, sorry, comrades, TAC is still entertaining that. We find it when we are coming. There is this issue, another, is Hapani? What? Yes, Hapani. And it is not a Hapani only. They discharge patients being ill, and the other patients died. It's like last week died on the taxi rank. So please, liya ilimiona miya ilangutela yona mbajela ba venda laba ku na hina machangani la ku tekeriwa nhlokweni budget leya a yi tirhi ba hi akela xibedhlele xa hina.
Thank you, comrade. Comrades, I'm going to the back now. I'm seeing only 5 comrades. After these 5 comrades, I cut any further inputs to the minister. I got 3 at the front. I got 2 at the back. Okay? 3 at the back.
Hello,
and I
hello.
also ask comrades, please keep it short. Okay? Please, otherwise I'm going to interrupt you. I understand the importance of speaking, but keep it short. Comrade at the back, and then Patrick, and then to the back, and then this comrade, and so on.
Aye. Thank you, Jabulan. Mr. MEC, Ntate Joe Phahla. Comrades, ko tswa hanyane, but Ntate Phahla, ko bua ka di EPWPs. Spot on. EPWPs. Ntate Phahla, I think all the clinics, EPWPs are the ones that are the backbones of those clinics. If you visit clinics around Garangua in Tshwane or Tshwane as a whole, you find out there's only 2 permanent staff in each department. Example, data capture, 2, the rest, EPWP. But the very same department, that the Joe Patla, you are not taking this EPWP serious. When they just ask for absorption, they've been there, we have been there for more than 13 years. But our very same department is doing nothing about them. Instead of absorbing them, here's the door. I submit.
Thank you, comrades, and thank you for keeping short. Thank you very much. Patrick.
Thank you, Minister. Thank you, Chairperson. Mine is just 3 issues. One is around the NHI. We already, Comrade Chairperson, Comrade Spongile covered great details on that.
Speak louder, and comrades, please be quiet.
We remain worried about the NHI, the dragging, and the time that is actually taking. We are even now more scared. So we would like just to get an update in that. The second one is around the U is equal U. I'm worried, Minister, around the messaging of U is equal U, the message that we're giving the community. It kind of a mixed messaging, and there's a huge gap, and we are not hearing very clear message that is coming from the Department of Health in leading the campaign, but also in contributing the big campaign that's supposed to be going in hand with that. And the last one, it's around the issue of the healthcare system itself. We are reviewing the National Strategic Plan right now, and that particular National Strategic Plan should be implemented by the Department of Health. We are worried about the budget cuts and the healthcare system at the local level, leave alone the district and the provincial hospitals and all that, which also they are in shambles in a way. We are worried about all that. But my question is, how can we help the minister? Right now, we are tired. You can see my techies are off now. We are tired of toying and marching. What is a plan, what is a program that we can put in place in working with the government to make sure that we improve the healthcare system, particularly at the local level? I thank you.
Thank you, Comrade Patrick from KZN. Comrade at the back.
Greetings to the Minister. My name is Tembile Chabalala from the Northwest Province. I will be short and brief. The first question is, Northwest is one of the most provinces with the highest number of stock out. So the minister has mentioned that the return program is in progress. And with that, how is it going to be effective to our communes where else we don't have the medicines? It has also affected the length of HIV medicine refills in the Northwest, and it is one of the worst provinces in South Africa that has, in terms of expanding the ARV refill. Number 2, it is a resolution, or I could say a suggestion in terms of the mental issue part. I'm very pleased that you mentioned that, and we would like to suggest as the Northwest Province, in terms of mental issue cases, let that not be only social workers available at the clinics, but also psychologists and psychiatrists, because of social workers are not equipped to deal with mental issues, but social issues. So we suggest that psychologists and psychiatrists be planted and be placed at a local level so that we deal and they adhere to the mental issues of our communes and people who utilizes the services of the Department of Health. Also, we have a problem with the district hospital that was closed in the Northwest Province, which is Tusong, which was catering for several communities now that they are suffering and hovering and overcrowding certain healthcare facilities that they are nearer. So those health facilities can't cater for the number of communes that come to those services to require the services, to those facilities, to require the services. So we request the Department of Health, as the minister is here, to give us an alternative facility that will also assist, since the Tusong District Hospital has been shut down and it wasn't communicated with the communities. They are now left in distraught and have to travel a lot, and some of them result in defaulting in their medication because of they don't have money to travel to far facilities where they could get services. Thank you.
Thank you, Comrade. Comrade at the front.
Oh, thank you very much, Program Director, our chairperson, and greetings to Comrade Minister. You're welcome. I want to extrapolate from the announcement that Comrade Minister has made here, whereby he said they've taken a progressive stance on like for instance, a mitigating strategy to train the healthcare workers to deal with the issue of welcome back. So I'm concerned that because there are ongoing shortages of staff, so I believe that it's likely to, for instance, to defeat that purpose. What is the turnaround strategy on this acute of shortages of staff in order for this to be feasible? Then I want to go to the issue of the general dilapidation of infrastructure and security. I mean, that is a very serious issue. If I can give just a 2-second, an example. On Monday, I was in Kempton Park Spartan Clinic, and an hour after my arrival, somebody went there carrying a gun. He was later identified that he was a taxi driver, furious, and indeed posed a very serious threat, demanding medication and explaining his plight, that he has been in on four different health facilities, and he has been sent, from pillar to post as a result, because he had left his ID at home, and he realized that he doesn't have medication, so he went to the nearest clinic, and he was told that he must produce an ID, although he appears on the system, and therefore he was sent to pillar to post out of his anger. Then he took a gun and went to threaten the staff. Fortunately enough, nobody was hurt around that vigilantism, if you like. So the question of security, it's an apex matter which I believe Minister will have to take into consideration. I want to come to the issue of the high cost of medication. Sometime 2007, a political party that Comrade Minister belongs to took a resolution that will put a recommendation that South African government should build a state-owned pharmaceutical company to mitigate against the high cost of price. Therefore, I would like to know as to how far are you with the implementation, or perhaps in terms of arguing on those issues. Lastly, as I depart, there are no condoms, Minister. Please do something. There are no condoms indeed. It's not a joke. Thank you very much.
Thank you very much, Comrade. Comrade at the back.
Apologies for...
Yeah.
Yeah, me. Apologies for my voice, Mr. Minister. We are concerned about the continuing clinic closures in Western Cape. According to the National Act, it states that there should be a clinic within a radius of 5 kilometers. Now, considering the overgrowth of the population and the closure of clinics, this act is being taken away from our people. Thank you.
Thank you, Comrade from the Western Cape. Thank you very much. 2 more comrades left. This comrade at the front and then the comrade at the back. And then that's, we're done with questions. Thank you.
Thank you very much, the chair of the day. I have 2 concerns to the minister to check on it. Minister, please recheck or revisit the policy of TB. 1, you have closed the isolation facilities of TB, like MDRs, XDRs. So please revisit that policy, because it shows that TB is still a killing factor of life, mostly for people living with HIV and AIDS. Secondly, the last question, or the last request. Minister, please revisit or let your department take the issue of CSW so serious. CSWs are undermined, are calling by names. They are not taken like colleagues. Please empower the CSWs and think about it. They are human beings. They've got children. They are getting old. Then they will be sent home without nothing. Please revisit that case of CSWs.
Thank you very much, Comrade.
Okay, ngiyabonga, Chairperson of the day. So mine, I think comrades have covered me, but I have to ask Minister ukuthi what is the plan when it comes to eradicating the pit toilets, especially in rural areas? Because there is a serious problem of the pit toilets being full and unusable and unhygiene. So as we said, as TAC, that we support the Section 27 of the Constitution, I think it is also violating the rights of patients in those facilities and the dignity of people. So my question is around that one. And also, one other thing that I want to say is, comrades, this thing of the medical xenophobia, we need not to shy away that this is a result of the failures of the department. That's why we are here, so yeah.
Thank you very much, comrade. One of our partners indicated he wants to say a little bit. As long as he keeps it short, I'll allow it. This is the last person, and then the minister. Minister, you want to say a few words in response? Yes.
Good afternoon, Minister. First, thank you for your introductory remarks and acknowledgement of all the progress that we've made over the last year. But I think it would be remiss of me to say that COVID wasn't an equalizer. COVID was disproportionately borne by the poor, right? With over, like they said, 300,000 excess deaths, 120,000 official deaths. So many people never even got to a health facility. Many people weren't even able to access a test. You know, and it's really sad that we can look back and say it was an equalizer. Close to half of hospital admissions were in private hospitals with people with medical aid. You know, so with 300,000 deaths, I don't think it was a public health success. And it's something that we could have avoided with better regulations. The irony is that the burden of the longer-term impacts of COVID, the economic impacts in particular, will also be borne by the poor. You know, cuts to the provincial equitable share means that there will be less healthcare workers employed. Right? Again, the poor, 90% of them rely completely on public services. You know, so I think we can't allow this moment to pass and say that we can all come back and the status quo is okay. I think we need drastic change. And we have to give life to the aspiration that we have in Section 27 of our Constitution. Everyone has the right to health, right? And we also have to look at Section 9, that everyone has the right to equal enjoyment of those rights. If we've learned anything in the last 2 years, is that enjoyment of the right to health is not equal. And we have to figure out as a society how we better respond to that. But our comments around exclusionary remarks, around race, gender, ethnicity don't help. Congratulatory remarks like we've weathered the storm don't help either. And I think we have to take this opportunity to write the Constitution into our hearts and work a little bit harder to ensure that we have equal enjoyment to the right to health. During COVID, we didn't. And 180,000 people died without getting a test, without getting into a facility, and died at home not knowing why. Thank you. Over.
Thank you, Comrade Russell from Rural Health Advocacy Project. I'm now handing back to the Minister. I think there were many, many questions. He won't be able to answer every single question, but I think he's heard every single question, and I'll invite him to respond. Thank you very much, Minister. Thank you.
Thank you very much. Thanks to Comrade Mark and all the comrades who raised a number of issues. Indeed, I will not attempt to go one by one. I think that will be, otherwise it can take us quite a long time. But just in terms of trying to get the overall, many of the questions and comments, there were some specific areas, but there were also common areas. Amongst those, the issue of the remaining challenges of capacity of our health facilities in terms of programs which we are pronouncing, whether they can be implemented, including the Welcome Back campaigns, and also just in terms of a number of comrades have indicated that the just basic things where people get turned back instead of receiving services, including those who have missed their appointments when they come back, the attitudes, even as some improvement is showing. So there's a lot of work still which needs to be done, and that's why overall one would say that, as I said in my earlier input, that we see the roles of yourselves as a civil society organization as being complementary, because as a government, firstly, as a national department and ministry, we rely on a number of, firstly reports which we get, formal, but also our own oversight, visiting facilities, seeing for ourselves, but it just can't be enough. So don't underestimate, therefore, including some of the things which some of the comrades here have raised specifically, I've noted, so that one can be able to follow them up. So don't be discouraged in terms of the work which you do and being able to feed back to us on your observations, on your oversight. I know that it's also mentioned that in a number of either municipalities, districts, and even at provincial level, the response of the people at our leadership levels, it's not always very helpful. Now, I would want to say that working together with your leadership here, quite often, I know we don't get everything, but quite often, comrades, when they pick up something, they do send us messages. And, so if you go to a particular facility and there's particular observations which you make, I'm sure within the TAC you also do have your system, just so that these things can be synthesized. So from time to time, some of the issues which get raised, sometimes it's when we do have meetings, but I would encourage comrades in the leadership that they must not be discouraged in terms of when your members on the ground pick up certain issues, because we can't be everywhere. To make sure that you send us. So we do appreciate, I think there's a comrade who said, we're going to be sending you, was it Comrade Shabalal, that we're going to be sending you all these messages. We appreciate them. So we do appreciate, because that's the only way we are able to then pick up a phone and sometimes even say to some of our own people at National to say, please go to such and such an area, go to Khapane area. There is this kind of a complaint. Of course, we still have to make sure that we interact with the province, but we also have a responsibility to can go right in the area and check, for instance, the issues around Elim Hospital. Fortunately, I will be in Limpopo on Friday, but it's a specific, on a specific follow-up, but I will be with the Premier and with the MEC. We're going to follow up on those issues. But I can just indicate, for instance, that from the national support to Limpopo in terms of health facility revitalization, I know that Elim is on the list. But if the comrade is saying, even while it's on our list to support the province in terms of infrastructure grant to upgrade the hospital, already equipment is being moved and all that, those are issues which we'll be able to take up. But if I didn't know, I will not be able to follow up on that. So, so basically, yeah, one will be able to follow up on some of the issues of staff shortages. I can just say to comrades that indeed, it's also made more open to be seen because of the fact that at the pressure of COVID, there were specific, as you would remember, the president in 2020 June gave a pronouncement as there was a special kind of state of the nation based on the COVID situation. And also there was even an additional budget vote to try and add additional funds to our health facilities. Amongst those were funding for additional posts. But as we go back to normal funding, some of those funds are being withdrawn. And it's a matter which we are taking up. I had a meeting with the Minister of Finance and the DG and the Minister's team, wherein the issue of human resources was quite top. And we're working on that, looking at various ways in which the depletion of posts should be stopped. So it's a matter which, you know, we are dealing with. Realistically, because of the fact that when, you know, the fiscus is not growing, there is a limitation. We did have at least some positive development in the last budget, in the sense that there was some, the South African Revenue Service did manage to collect additional to what they had projected, and we were sort of beneficiary to that to a limited extent. But it helped us to retain some of the posts, even be able to fund, for instance, community service for doctors and interns, but also other health professionals. So, but we are in a very serious discussion on that matter to try and I can tell you that the president has also raised his own concern about the reduction in funding for health. So it's a matter on which at least one can say, I don't have the support of senior leaders. It's just a question of making sure that this does not remain at agreeing on the concern, but is realized in terms of actual allocation. The EMS as well, that's a matter which we have put on the table with our colleagues in the provinces to make sure that there is a very concerted effort, because EMS is very key. I mean, it makes a difference between life and death. If you are not able to access emergency medical services, it makes a difference into whether a person may live or not. The issue, maybe just quickly on the Pfizer and the vaccines. Well, it's true that we definitely did not reach our target. Our target was to reach 70% of the adult population. We have not yet reached that target. We now overall sitting at about, on average, about 52%. There is over 70% of the age group of over 60. It's sitting at about 72%, and then followed by those above 50, sitting at about 66%. But the reality is that and the reason why we didn't reach that was not, as comrades have said, was not because of lack of trying and lack of capacity. Working together also with a number of private service providers, private pharmacists, your pharmacy chain stores, and even community pharmacists came to the party, and a number of other health providers. The public service as well, our nurses and pharmacists were, you know, even going out with outreach programs. Where we just, you know, couldn't make further move, every time when the waves would get lower, where people hear that less people are getting sick, fewer people are getting to hospital, then few people actually come forward, and especially the younger people. So if we were to make better inroads in the young people between the age of 18 and 35, that would make a lot of difference. That's the age group where we totally struggled. I think we didn't even reach 40% of coverage between the ages of 18 and... So that is also comes to the question which other comrade raised about Aspen. Because Aspen, we really drove the encouragement on the local companies to produce the vaccines. Aspen started with just what they call fill and finish for Johnson & Johnson. But later on, they actually, with our support, pushed for full licensing, where they could actually produce the vaccine fully, and they were able to get that full license. But at the time, already, the uptake of vaccines was already low. So now we're sitting with a situation where, I mean, even ourselves, it's very embarrassing and difficult. We're not able, I mean, we're negotiating with Aspen not to hold us liable for the orders which we have made upfront, because because now, I mean, on the average on a weekday, we are lucky to get 15,000 vaccine doses administered. Most of the weekdays we get about 10,000, 12,000, mostly boosters, and very few, maybe about 3,000 new people coming to take the vaccine. So that is putting a lot of pressure on the manufacturing. It's a matter which, I mean, it doesn't augur very well in terms of the sustainability of the industry. On the comrade mentioned also on the Pfizer, because of at the time when Johnson & Johnson through Aspen had a number of difficulties, there were a number of times when there was issue of contamination in the US. There were issues where Johnson had to stop for a while because of adverse effects which were picked up in a number of countries. So we pushed on the Pfizer vaccine doses. So we accumulated a lot of the Pfizer, and also because it can also be administered for children below the age of 12. Now, what we're sitting with Pfizer, because of its the way it's manufactured, has a shorter shelf life. So it expires, quicker because it needs very, very low temperature, about minus 70 degrees, to be stored. So it has a shorter lifespan compared to the Johnson, which, the doses which we have of Johnson can still go up to the end of 2023. So, in fact, the 92,000 which have already been disposed of for Pfizer, it's basically just a tip of the iceberg. We are going to have to dispose a few millions come the end of this year. As I'm saying to you, we're sitting with close to 10 million doses of Pfizer vaccine, and on the average, we're now administering on a weekday about 10,000. So you can imagine when you're sitting with over 10 million doses and they are expiring at the end of the year. There's some other private companies have come forward to buy some of the doses, so we're going to save some money. But some of those doses, a few millions out of that 10, we won't be able to sell all of them. So we're still going to have to dispose. But what we are saying to this capacity is that this is not the end of viral pandemics. So we encourage still our pharmaceutical companies and our researchers to continue to look at this technology and capacity which has been now acquired to make sure that we can be able to look at other vaccines, including for TB, for HIV, for cancers, with the technology which is now available. We encourage them to do further research and see if some of this technology can then be expanded to be able to cover us, to be ready for future pandemics, but also for the existing pandemics in terms of other infectious disease and also including cancer. Chair, I think maybe let me not try to go one by one, but I've noted the various matters which comrades have raised. What we could do is that your leadership, following this, I'll take that up, most of the matters. Some of them, as I've said, the Limpopo issue, I will be there on Friday, I will be able to take them up, and others will be able to follow up. I think we must just develop a system once your Congress adjourns, so that some of these issues we can be able to follow up. Thank you, Chair.
Thank you, Minister Sibongile. Just before you give a vote of thanks to the Minister. So I hear, Minister, about developing a system once this Congress is finished so that issues can be forwarded to you and can be fanned out and addressed I note also that you've heard comrades from the Western Cape talking about closing down of clinics. And what I would say, Minister, is this issue of vaccinations is an issue of precisely why you need organizations like the Treatment Action Campaign to work with you. Because the low take-up is not because of no demand. It is because many people are still unable to access vaccines because we are not taking vaccines to where the people are. That's the problem. I know that from working with homeless people. I know it from working with poor people in the inner cities of our cities. They are constantly complaining that they cannot get vaccines. So even now, I think it's not too late to say, rather than throwing away millions, as you've said, spend the money on getting those vaccines to the people who still want them and who will still benefit from those vaccines, and make a plan with TAC. Put TAC and other organizations to the test and say, okay, we've got the vaccines, let's see if you can put your mouth where put your money where your mouth is. We don't want to do your job for you, but we do want to save lives where possible and save money. So thank you very much, Minister. And I need to ask Comrade Sibongile to just thank you formally. And
Viva! Viva TAC, viva! Amandla! Minister, we would like to thank you again for honoring our invitation. We really appreciate the honest discussion that we had, and we hope that we'll continue to have it going forward as Treatment Action Campaign. And thank you for responding to most of the issues that we are raising with you, and we are responding positively to that and the commitments that you have made. Although we have a relationship with the department, but that doesn't mean that when we have to hold the Department of Health accountable, we will be shy to do so. So we know our relationship, where it stands. It stands on providing quality healthcare services for poor people on the ground. So that's where our relationship is based. So if things are not going well, we'll make sure that we hold the minister accountable. But we felt that it will be honored for us to provide you with our Congress pack. Unfortunately, I need to be honest. I'm a very honest person. We took out our Congress book because there's a lot of information that we think that belongs to TAC. We don't want it to be in the government disposal yet until we release other information. So we will give you T-shirts, and please wear them. And we would like to see you wearing them publicly. Don't wear them under your shirt.
Comrade Minister, thank you very much again. Comrades, I'm just taking instruction from my bosses. We're late. We are now going to break for lunch and take a lunch. I'd like to ask comrades to please be back by 20 to 3, okay? 45 minutes for lunch. I'm sorry, but we have guests here who still need to speak before they leave. We also have the Institute for Electoral Something to announce the results of our leadership elections. But it's been a long morning, so can I just ask that provincial leaders make sure, comrades, that we are back in this room by 20 to 3, because there's still quite a lot of business before the end of this Congress today. Thank you very much.
1, 2. Kancane sekusele kancane. Asiculeni comrades. Kancane sekusele kancane. Kancane sizophumelela. 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 We Free State sekusele kancane. Kancane sizophumelela. Sekusele kancane. Kancane sizophumelela. Shwele shwele. Ushabalala ushabalala. Shwele shwele. Ushabalala ushabalala. Ushabalala ushabalala. Ushabalala ukhuzi nonsense. Ushabalala ushabalala. Ushabalala ukhuzi nonsense yakuleya. Shwele shwele.
Comrades, can we please take our seats? Welcome back from lunch. I hope you all got energy restored for the last few miles of the TAC Congress of 2022. We still have to adopt resolutions, the final resolutions. We still have to hear about the new leadership of the TAC. Comrades, please, quiet. So the way we're going to proceed for the rest of this afternoon is I'm going to start by taking a message of support from Comrade Sharon Nikambaram, from Lawyers for Human Rights, also a veteran of the TAC of many, many years. Then I'm going to ask the Electoral Institutes of Southern Africa to come up here and to announce the new leadership of the Treatment Action Campaign arising from this Congress. Once we have seen the new leadership, we will then go back to the resolutions. There are still many resolutions that Lottie and Bhutto need to take us through, and that we need the formal stamp of approval of the TAC. There are still some further messages of support, and then there is the closing speech of the chairperson, the newly elected chairperson. After the IEC has, the Electoral Institute has announced the new positions, I will stand down as the chair of this Congress and hand back over to the national office bearers to chair the Congress. My role will have been fulfilled. But also I have to go and speak at another conference at 4 o'clock. So I'm going to start by asking Comrade Sharon to come up, and I assume, comrades from the Secretariat, that the Electoral Institute is ready to come up as soon as Sharon has finished speaking. Thanks, Comrade Sharon.
Viva TAC, viva! Viva TAC, viva! So yes, comrades, I am a veteran of the Treatment Action Campaign. I was the first provincial coordinator of TAC in Gauteng with Fanai and the other comrades who back in 1999. So I've got 4 points that I want to address to the Congress today. The first point, which actually arose while I was watching the Congress on Saturday, is that the Treatment Action Campaign, I want to appeal that the resolution that was taken this morning gets included in the resolutions that are being discussed and become part of the official resolutions of this very significant Congress that's taking place in one of the most difficult times in our history as a people in South Africa, in Southern Africa, and on the African continent. There's a number of issues. We've spoken about COVID, and Comrade Russell correctly pointed out that COVID, the regulations, everything about COVID disproportionately impacted on the most vulnerable, the poorest in society. And there's been no mitigating against that. You've not seen the government say the poorest people suffered, the informal sector was locked down. Let's invest and address that. Let's roll out a universal income grant to deal with that. Nothing. We're continuing, and we're worse off than we were, if that's possible, with being one of the most unequal societies in the world. So this Congress has to commit itself to smashing patriarchy, comrades. Smashing patriarchy. You can't transform the society when you have patriarchy in practice, and you have patriarchy which is in the interest of men. And so, Comrade Ruth addressed the Congress on Saturday, but there was silence about the crisis in NUMSA. And I want all the comrades to go and study what's happening in SAFTU and in NUMSA. It's a crisis of patriarchy that's destroying a very, very good, progressive federation of workers. And we don't want that to happen to TAC. And so it's a great day, it's a powerful day, what TAC has resolved to do within the organization in smashing patriarchy. And I would say, and I'm nervous to say this, but the new leadership should have the mandate to ensure that the next election elects who you represent as the most affected in society, whether it's HIV, whether it's COVID, whether it is black African women in this country. And that must be represented in the leadership of this formidable movement called the Treatment Action Campaign. The second point I want to make is that I want to call for a sector that represents veterans. I think that active veterans, veterans who want to continue to be involved in contributing and giving our time to build this movement and keep it in what the leadership that's just going to be, that have been elected up to this point, they've kept this organization in, as I said, a very difficult time, and I want to take my hat off to that leadership. The last 2 points, I was TAC remains one of the most active movements on the ground that is international. It's not narrow national chauvinism. The solidarity for the comrades in Delhi, that was powerful, comrades, that was powerful. And TAC was formed to build international solidarity. And I want to say amandla and continue with your struggle to build an international movement. And it's this narrow nationalism that is destroying our country and in fact destroying the African continent with the rise of nation states that are against poor people, not the rich. It's the rich and the corrupt that are having a heyday. And my final point, and I welcome your resolutions on xenophobia. I want to welcome you, and I know you have been involved in Kopenhagen, Africa Against Xenophobia. I'd love to see TAC involved in this movement to teach us how to build and how to work in solidarity. But I'm really, really concerned about the 2024 elections. And I wonder if TAC is considering, do we call for the ANC to go? Have we had enough of this organization that has destroyed this country under its leadership? And what platform are we going to stand on to galvanize civil society to hold any government to account? And that's critical. Before you leave, I appeal to you to give us direction and to help us to unite in following you in how do we deal with what I think is one of the most critical things that's going to challenge us, the elections of 2024. Amandla!
Thank you, Comrade Sharon, the first provincial coordinator of Gauteng from all those years ago. Thanks, Sharon. So 2 specific proposals that the Congress should consider arising from Sharon's speech. I'm not opening them for discussion now, but when you come back to resolutions, I would like you to consider it. One is the proposal of creating a sector for veterans of the TAC. It doesn't mean doing it immediately, but looking into how you do that. I can be part of that sector as well, happily part of that sector, but I'm sure many other comrades would as well. But the second is a suggestion that TAC needs to start discussing its approach to the general election of 2024 sooner rather than later, and to form an independent, social justice-based position in how it approaches that election. So I leave that to you, comrades, to return to that. And the third point I would say in response to Sharon is that TAC will certainly stand by its renewed commitment to non-sexism, to genuine equality of behavior, of conduct, etc., etc. And I will make sure as a member of the board of directors that the National Council develops the program that we talked about in that session this afternoon. So thank you very much, Comrade Sharon and Lawyers for Human Rights, and for the work that you are doing in fighting xenophobia in particular and working with migrants to our country. Can I now ask that the the Electoral Institute of Southern Africa, I think it is, come up and announce the process of the new leadership. I don't see anybody jumping out of their seats or coming up here. Can I get direction from Lottie or Bhutto where the people are? They're outside. They're coming in. I'm about to hand over to the comrades to explain their process. As I stand down, I just want to say thank you, comrades, for the honor to be able to chair this Congress this morning. It means a lot to me to still be connected to some of the greatest activists in South Africa and some of the greatest activists in the world, and to know many comrades here. We fought in the trenches together for many years, and I will continue to fight with you. I've been inspired by what I've seen at this Congress. Although the resolutions have not yet been adopted, I think that those resolutions are extremely important as a blueprint for TAC struggles in the years ahead. And I hope that those resolutions will be discussed by every single activist in TAC and every branch of TAC, because if comrades understand those resolutions, then they will understand what TAC is about and what TAC stands for. So I hope that you will all make a commitment that those resolutions will be, people need to be able to recite the resolutions. They need to sleep and dream those resolutions and ask where we are in making progress with the resolutions. So, great work, comrades, and great sacrifices. We're now joined by the electoral officers for this conference. I'm very grateful to the comrade for coming here. You're welcome to join me on the stage. I will step off the stage and hand over to you. And if you can just, you may have introduced yourself already, but if not, please do so again. Thank you.
Viva ATC, viva. TAC, I'm sorry, TAC. I was not far off, but excuse me. Thank you for having me again. My name is Sipiwe. I represent ISA. I am the assigned presiding officer for this Congress. We are ready to announce your new national office bearers. We are nearing the end of this election process. But before we get to the results, I would firstly like to thank TAC for giving us this opportunity to assist this Congress. Also would like to thank this Congress for displaying maturity and cooperation during this election process. We have observed the following in this Congress. We have observed the culture, we have observed a climate conducive to free, fair, and transparent elections, consistent with the international electoral standards in similar elections. The process was clearly communicated with all members openly, honestly, and constructively. There was never any petition to rerun this election process, indicating that the election system was accurate in administration and straightforward in application. The process and the results thereof are a credible and legitimate indicator of the will of those who took part in this election process. The election process was, to all intent and purposes, transparent and trustworthy. All candidates were nominated unopposed. ISA is therefore satisfied that generally the election process was done in accordance with the provisions of the TAC Constitution. I therefore would like to declare these elections free and fair. These are the results. For a position of chairperson, nominated unopposed and thus duly elected, is none other than Sibongile Shabalala. For a position of deputy chairperson, nominated unopposed and thus duly elected, is none other than Anna Maluleke. Anna is not present in this Congress. Next position is that of General Secretary. Nominated and opposed, and thus duly elected, is none other than Anele Waya. Yawa, Yawa. For a position of Deputy General Secretary, nominated and opposed, and thus duly elected, is none other than Patrick Mdleje. For a position of women's sector, this position was deferred to the NWC for consideration. We'll move on to the position of men's sector. Nominated and opposed, and thus duly elected, is none other than Simon Shongwe. For a position of LGBTQIA plus sector, nominated and opposed, and thus duly elected, is none other than Philemon Twala. For a position of PL HIV sector, nominated and opposed, and thus duly elected, is none other than Fikile Mtsweni. For next position, the last, but certainly not the least, youth sector, nominated and opposed, and thus duly elected, is none other than Rin Ndlovu. Rin is also not in this Congress today. Rin is also not in this Congress today. As ISA, we would like to congratulate the newly elected national leadership, and we wish you all the best in your term of office. May the stars that guide TAC also guide you during your term. We thank you.
Amandla, Amandla, Amandla. Viva TAC, 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 viva. She's the leader, no. She's a fighter. She's a woman. She's a leader. Oh, Zabalaza, Zabalaza, Zabalaza. Oh, Zabalaza. Oh, Zabalaza. We Zabalaza. She's a woman. She's a leader. She's a fighter. She's a leader. Oh, Zabalaza, Zabalaza, Zabalaza. We Zabalaza. We Zabalaza, Zabalaza, Zabalaza. We Zabalaza. She's a woman. She's a leader. She's a fighter. She's a leader. We Zabalaza, Zabalaza, Zabalaza. We Zabalaza. We Zabalaza, Zabalaza, Zabalaza. We Zabalaza. She's a leader. She's a woman. She's a fighter. She's a leader. We Zabalaza, Zabalaza. We Zabalaza. We Zabalaza. We Zabalaza. She's a woman. She's a leader. She's a fighter. She's a leader. Oh, Zabalaza. We Zabalaza. Oh, Zabalaza, Zabalaza, Zabalaza. We Zabalaza. Oh, Zabalaza. Oh, Zabalaza. She's a woman. She's a leader. She's a fighter. No woman. No. She's a leader. Oh, Zabalaza. Oh, Zabalaza. Amandla. 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 Sijonge ngane tena. Sijonge ngane tena. noma kunzima bafana thena siyoke noma kunzima bafana sisho ngengane thena sisho thena noma kunzima bafazi noma kunzima bafazi sisho thena sisho ngengane thena noma kunzima bafana noma kunzima bafana sisho ngengane thena sisho ngengane thena noma kunzima bafana noma sisho ngengane thena sisho ngengane thena noma kunzima bafana amandla otheko fona zomthoma iyo kulezi phendlele zonke utheko fona zomthoma iyo kwalama province wonke zothome mina ngiyathomeka iyo kulama branches wonke zothome mina ngiyathomeka iyo kulezi phendlele zonke zothome mina ngiyathomeka iyo kulama province wonke zothome mina ngizothomeka iyo kulezi phendlele zonke zothome mina ngiyathomeka iyo kulama branches wonke zothome mina ngiyathomeka iyo amavenze wonke amandla ayethonyelwe ngubane amagama ayethonyelwe nguTAC ayethonyelwe ngubane amagama ayethonyelwe nguTAC ayethonyelwe ngubane atonyelwe nguTheyise ayethunyelwe ngubani amagama avudumli ethunyelwe nguTheyise ayethunyelwe ngubani amagama atonyelwe nguTheyise ayetonyelwe ngubani ayetonyelwe nguTheyise ayetonyelwe ngubani amagama avuthu yethonyelwe nguTheyise amandla 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 viva TAC 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 viva viva TAC 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 viva siyabonga.
Comrades, thank you very much. We now have a new leadership in place. I hope the comrades are going to meet sooner than later, as soon as possible, that you're all going to commit to working together, that you're going to have a discussion about what the expectations of leadership are of each of you, what you commit to giving back to TAC. You've taken on a hugely important responsibility to protect this organization, to take it from strength to strength, and to save lives in the years ahead. You have a heavy burden on your shoulders, but you have the support of all the comrades in this room. You have the support of the branches. You have the support of the allies of the Treatment Action Campaign in South Africa and internationally, and you have the support of poor people in struggling for a quality healthcare system in this country. So we wish you strength in carrying forward this mantle of responsibility. I need to step down now. Wish you continued success with this very, very important conference. And I'm going to hand over to, I'm not sure who will take, is it the chairperson, who will take the proceedings forward from here. Thank you, comrades, and stay well and stay strong. Thank you.
Phakamisu 7 Phakamisa inombolo Phakamisa 7 Amandla Amandla Viva TAC Viva Viva TAC Viva Phambili ngabafazi phambili Phambili ngabafazi phambili Phambili phila HIV sector phambili Amandla Amandla. Thank you, comrades. So as now I'm reclaiming my space and taking over from the board member. Mark, thank you very much for your support and being there since yesterday to take over the program. We really appreciate your support. and your continuous support is really appreciated. And this goes to all board members. But I think, comrades, it will be only fair if we continue with our resolutions, and then after the resolutions, I will do my acceptance speech. I know that you're waiting for it. You'll get it. You know that we are running out of time because we're supposed, at least by now, we're supposed to be finished with our program. And we still have about 40 resolutions to go through. So, yes, we had about 82 earlier on, and then we added others, so about 40-something, if I'm not mistaken. So, I will ask this Congress to cooperate and maintain high discipline so that we continue with our business of the day, because we need to finalize them before we close this Congress. And this Congress has to adopt these resolutions. So as Comrade Buto and Loti are coming up, we will continue, and I trust them, we'll try to move faster. I'm not putting pressure.
Okay, comrades, we got to PEPFAR accountability.
Number 48.
Okay. Resolution 48. Sisonke, comrades? Okay. TAC should continue to advocate for PEPFAR to adequately fund South Africa's HIV and TB response in order to ensure that everyone can access the HIV and TB prevention and treatment, harm reduction services, and gender-affirming care they need. Resolution 49, TAC should continue to identify where international funding should be prioritized and gather data to support this. We must think strategically about the interventions we promote and in what order to ensure the best impact on the response.
Can we open this mic?
Come back here.
To save time, let me, okay. So, to save time, comrades, let me speak from here. Here are the two resolutions. Are there any additions? Any additions? In the absence of non-additions, are there any provinces who are not opposing? Who are not opposing? Who are opposing? Who are opposing these resolutions? Thank you. I think we can move on.
Okay. No, you've done nothing. On access to medicines, Resolution 50. Today, new generation antiretrovirals and long-acting injectables, as well as new medicines to treat cryptococcal meningitis, hepatitis C, drug-resistant TB, and many cancers are unaffordable and out of reach for large numbers of people. TAC considers it morally unacceptable that many medicines are unavailable, unsuitable, or unaffordable. We are committed to activism that will bring about a more rational and humane policy and legal framework to guide how society pays for existing medicines and for the research and development of new medicines. This includes activism through the Fix the Patent Laws campaign, as well as medicine-specific campaigns. 51. TAC will continue to put pressure on the Department of Trade, Industry and Competition, the Department of Science and Technology, and other relevant structures to force the urgent reform of our intellectual property laws. 52. TAC will advocate for the South African government and the governments of other high TB burden countries to invest more in TB research so that we can get better tests and medicines for TB. We'll also advocate for our governments to fund this research in ways that avoids high prices at the end. 53. TAC will advocate for wider reforms to the medical innovation system that will incentivize more research and development based on global health needs, including new TB medicines and new antibiotics, through initiatives that avoid high prices at the end.
Thank you. Any additions, comrades? Additions from the floor? Is there any province that opposes these resolutions? In the absence of none, thank you, comrades. Let's go.
Okay. On stockouts, Resolution 54. TAC is committed to reviving the Stop Stockouts project in the communities we work in, including ensuring community members use the SSP hotline when needed to accurately report stockouts. At community level, we will continue to monitor stockouts and advocate for systemic solutions to stockouts, both within and outside of SSP.
Thank you. Any additions, comrades? None? Any province that opposes this resolution? None. Thank you, Lottie.
On climate justice, Resolution 55. TAC will educate our members on climate justice and how climate change affects the public healthcare system and communities in South Africa. 56. TAC will monitor the impact of extreme weather events, such as the recent flooding in KZN, on the public healthcare system and advocate for short, medium, and long-term solutions to mitigate their impact.
Additions? None? Opposition? None. Let's go.
On corruption, 57. TAC will publicly call out corruption and corrupt officials who take resources from citizens at all levels, including local, district, provincial, and national levels. 58. TAC will continue to work to root out all forms of corruption internally. This includes through the appointment of an internal auditor and the creation of internal mechanisms and disciplinary processes.
Thank you. Any additions, comrades? Additions? Opposition? Can we continue? Thank you.
On solidarity with international struggles, 59. TAC will continue supporting public healthcare users, people living with HIV and TB, key populations, and all our comrades globally in their fight for equitable access to quality healthcare services. 60. TAC stands in solidarity with the Delhi network of positive people and other comrades who have held a peaceful, non-stop protest at NACO offices to demand an end to ongoing stockouts of ARVs. TAC stands in solidarity with DMP Plus and calls on all stakeholders in India and across the world to support their protest. We call on the Indian government to immediately resume monthly ARV supply. When the world is talking about dispensing ARVs for 6 months at a time, it is a shame that the pharmacy of the developing world cannot even supply 30 days of treatment to its own people. We recognize and sympathize with the anger of DMP Plus at these inexcusable stockouts. We recognize their resilience in carrying on their protest against all odds. We know how mentally and emotionally difficult it is to carry on. We support DMP Plus and stand with them in their struggle. 61. The TAC stands with the peace-loving people and especially our comrades living with HIV in Ukraine. The unprovoked Russian invasion of Ukraine has led to indiscriminate killing and maiming of innocent civilians and the destruction of entire cities not seen since the Second World War. We are particularly concerned for the estimated 260,000 people living with HIV who have had their healthcare taken away from them. As the TAC representing people living with HIV in South Africa, we understand more than anyone else what it means to be deprived of life-saving medication. The destruction of health services in large parts of the country is a special form of brutality and will lead to further loss of life. The invasion of Ukraine has upended more than 2 decades of work by government and Ukrainian NGOs such as the Alliance for Public Health to turn the tide against HIV. Ukrainians have been role models in the successful management of HIV in people who use and inject drugs and other key populations. These gains are in danger of being reversed. We call on the Russians to end their brutal war and withdraw their forces immediately from Ukraine. We applaud the efforts of the UN agencies and the international donors, such as the Global Fund, to support the provision of ARVs and methadone, even in these circumstances. We call on the international community to increase its support to protect and rebuild the health service in Ukraine, and especially their HIV treatment program. We stand in solidarity with the all-Ukrainian network of people living with HIV in this difficult time and salute their bravery and resilience. We call upon the South African government to see the invasion for what it is, an inhuman and brutal invasion that has caused mayhem and destruction in one country, but has led us to the brink of an economic, fuel, and food crisis across the world.
Thank you. Any additions, comrades, to the resolutions?
Yeah.
None? Any opposition? None. Thank you.
Okay. We're on sectors, right? Okay, comrades, so on sectors, Resolution 62, TAC endorses the following sectors: people living with HIV, women, key populations, youth, and men. Resolution 63, TAC will expand the LGBTQIA+ sector to be the key population sector from branch working committees to provincial working committees to the national working committee. While an elected member will be the key population sector representative at various levels, committees will be constituted of a variety of key population identifying members, including LGBTQIA+ community members, sex workers, and people who use drugs, to ensure the perspectives of all key population communities are represented in the organization at all levels. We note that some people already have multiple key population identities. Resolution 64, the women's sector is renamed the women's sector with an X in order to be more intersectional, avoid the suggestion of sexism and spelling of men and man, and to be inclusive of trans and non-binary people, and to better highlight the nature of the scourge of gender-based violence in the country. 65, TAC sectors will work in two ways: to work internally, Resolution 65. TAC sectors will work in two ways. First one is to work internally to dismantle oppressions and to use community-led monitoring data to inform engagement with duty bearers and activism relevant to the sector. 66, in order to accurately represent our membership and meaningfully fight for justice for key populations, TAC will expand the LGBTQIA+ sector to be key population sector from branch working committees to provincial working committees to the national working committee. The key population sector will be constituted of a variety of people who identify as key populations, including LGBTQIA+ sector members, sex workers, and people who use drugs, because we want the perspectives of all key populations represented in the organization. Okay, 67. The youth sector leadership must be no more than 30 years of age at the time of election. 68. TAC will utilize AIDS councils to our advantage by sending well-informed sector representatives to represent us in these forums with a clear mandate and set of advocacy demands based on community-led monitoring data. TAC sector representatives must represent TAC in the relevant AIDS council sector. For example, the youth sector representative must sit in the youth sector in the AIDS council. While promoting the specific advocacy agenda of the sector within AIDS councils, sector representatives must also address the wider concerns of TAC. Sorry, I tripped myself up.
Okay, no, it's okay. Any additions, comrades? Any additions? I'm not sure, Bobby. Where is your placard? Gauteng?
It's just 2 points I wish clarity for. Resolution 67 is not clear. It's vague and can cause problems in future. So I'm not sure if there's no other words or way that we can construct to be clear as to if I'm 30 years today and there are elections today, I therefore stand. Does that qualify me? So there might be calamities when it comes to that. So I don't know how can we rephrase it correctly, or maybe someone explain it better so that we understand it, because it's going to be like that in a constitution. The second one, I want to
Before you move to the second one, Comrade Pope, can you suggest how can we put it?
Okay. So I think we must we must first start to ask ourselves for a person who's from 31 to 35. Do we say do they qualify to be leaders of the sector now? If we say yes, then if I'm 30 today and tomorrow I'm turning 31, do I qualify to stand? So I don't know how, I'm just giving this example so that comrades assist me in constructing correctly words that which I wanted to put there.
Yeah, fortunately, this was discussed by the Congress, and I don't think that it has to be answered by us. I'm saying us, yeah. The Congress must assist. Comrade Tsile, Gauteng.
This is my suggestion, comrade. One, I'm suggesting that we should say if someone is youth, let it be from 25 to 35. That's my suggestion, comrade, because of after 35, I think now you are no longer regarded as a youth. Maybe you are there now, young adult or adult. I submit leadership, honestly. 25 to 35.
Okay, let me ask a critical question before you sit down, Comrade Sil. This Congress yesterday, they said TAC, we resolved that TAC will cater for anyone at any age, but the position of a leadership needs to start at 13. That's what we spoke about. So when now we are talking about 25, then to 30, what are we talking about?
Yeah. Now, comrade Sibongile, we say 13. One commission said 13, ne? Then now, let's start it from there, 13. 35 is the exit point, more youth sector. Am I making myself clear, comrade? 13, 35, exit youth. You are no more youth now, you are adult. I submit, comrade.
Okay, so if I get you a comrades, okay, I think KwaZulu-Natal want to assist. GS, it will be KwaZulu-Natal and then GS.
Thank you, Comrade Chairperson. The 30 that's over there, it was meant for a person to be elected to a leadership position. That a person that is at 34 or 35 has no interest in youth. But the person in 30 still has 5 years to lead and still within the struggle of the young people. So that's what it means. Electing a person that is 35 as today, where will we put young people that are no longer relating to him or her in those positions? So we meant that from, it was 23 and we suggested 30 in terms of that, because that person that is 30 still has 5 more years to lead that position. I submit.
Thank you. GS?
I think the chairperson of KZN has covered me. Thank you.
Thank you. So I think, comrade, it's clear the way the Congress has articulated it. So it means, Comrade Bobby, when you are 30 years today and the elections today, you are eligible because you are 30 years. You still have 5 years to go. But if you are 31, then you are not eligible because it might be that the next Congress finds you when you are 36 or 37. We don't know what are the distractions might occur. I think it's clear now. Can we leave it like this?
Yeah, it's clear. I think maybe, or can I say, it's open. Can you say 13 to 30?
I think this, it
Or
says
it's
must be
for
no
everyone?
more than 30 years. So it's open from 13
Everyone.
to 30.
Okay.
Yeah.
All is well. Thank you very much. My second, which I really wanted clarity. I know I'll be taking the facilitator back. you know, I read, but I read quickly and I couldn't digest it well. Can you kindly rephrase maybe the Ukraine arrangement? I saw the submission there, but I didn't really get to understand what is the position. Thanks.
Okay.
Can we go, yeah, can we go to that resolution? I think it's resolution number 60.
Comrade Bobby, do you want us to read it or do you want us to shorten it?
Can you read it again, Buto?
Okay, so I'll read it slowly.
Okay,
So it
before you
says-
read it, Buto, I see hands from Gauteng and Free State. I'm not sure.
61.
I'm not sure whether they are opposing or they are raising on a point of order. Bobby, sit down, please.
Mandla.
Await.
Comrade, I don't want the resolution today to create confusion in the future. When you're talking about 30 and 35, I hear you talking about only for leadership. What about for participation? If you are 30 today, you cannot contest for a position in the youth. But if you are 34, you can still participate in the youth. Are you talking about leadership or are you talking about participation? I want you to be clear.
Comrades, I don't think this Congress needs to track this issue of youth as if we are cautioning the youthness of the people, of people. We are talking about youth and the leadership position.
On the leadership
The
position only.
participation, if a person is 34 and still interested in participating in youth programs, that person is allowed to do so because that person is still around. But that person cannot be elected for that position. If you are 34 today or 34 this year, we elect you in 2022. In a 1 year time, already you'll be old.
Thank
You
you
won't
very much,
belong to that
Malida.
sector.
I just needed a clarity so that it cannot create confusion. If the houses agree on that you can participate, but you cannot lead in the youth, this fine.
Thank you. Free State?
Covered.
Okay, sure. Can you read the Ukraine one?
Okay, so the Ukraine one, which is Resolution 61, says, the TAC stands with the peace-loving people and especially our comrades living with HIV in Ukraine. The unprovoked Russian invasion of Ukraine has led to indiscriminate killing and maiming of innocent civilians and the destruction of entire cities, not seen since Second World War. We are particularly concerned for the estimated 260,000 people living with HIV who had their health care taken away from them. As the TAC representing PLHIV in South Africa, we understand more than anyone else what it means to be deprived of life-saving medication. The destruction of health services in large parts of the country is a special form of brutality and will lead to further loss of life. The invasion of Ukraine has upended more than 2 decades of work by government and Ukrainian NGOs such as the Alliance for Public Health to turn the tide against HIV. Ukrainians have been role models in the successful management of HIV in people who use and inject drugs and other key populations. These gains are in danger of being reversed. We call on the Russians to end their brutal war and withdraw their forces immediately from Ukraine. We applaud the efforts of the UN agencies and the international donors such as the Global Fund to support the provision of ARVs and methadone even in these circumstances. We call on the international community to increase its support to protect and rebuild the health service in Ukraine and especially their HIV treatment program. We stand in solidarity with all Ukrainian network of people living with HIV in this difficult time and salute their bravery and resilience. We call upon the South African government to see the invasion for what it is, an inhumane and brutal invasion that has caused mayhem and destruction in one country, but has led us to the brink of an economic, fuel, and food crisis across the world.
It is clear, comrade. Unfortunately, comrade, I won't allow discussion on this one because it was already adopted. So if we are going to discuss it, then you took us back to what we have already discussed. And you took us back because you said you didn't understand. So we did it for your understanding. But unfortunately, I'm not going to allow questions and discussion on these resolutions because I've asked any addition, there was no addition. Any opposition, there was no opposition. So you took us back to international solidarity while we are on sectors. So are we done with sectors, Buto?
So we're now going to TAC sectors policy focus areas.
Can you go?
So it's that's
No, we already did this.
No. So we're moving to after 68. We're going to be on 69.
Okay. So before we move on sectors, comrades, is there any questions? The issue of youth sector, I think it has been clarified. So are there any additions or questions? Going once? Going twice? Closed. Any opposition? Going once? Going twice? No.
Okay, on TAC sectors policy focus areas, TAC resolves that the PLHIV sector will focus on the following: pushing for the proper implementation of the National Adherence Guidelines and Welcome Back campaign strategy.
Sorry, Lottie, there's noise, comrades. Nombuso notandeka. Yo, guys. Comrades, do we still remember the house rules? But we keep on making noise, comrades. Sorry, Lottie.
The PLHIV sector will focus on pushing for the rapid rollout of 3 and then 6 month supply of ARVs to reduce unnecessary burdens on people living with HIV and the health system. Monitoring within TAC structures to provide support to TAC members with regard to long-term adherence, treatment interruptions, and treatment resistance. The key population sector will focus on the following: pushing for easy availability of lubricants in all public healthcare facilities, pushing for the provision of safe, friendly, welcoming, and confidential services for key populations at all health facilities, supporting efforts to sensitize branches, members, and leaders on key population issues and dismantle homophobia, transphobia, and all stigma and discrimination against LGBTQIA community members, people who use drugs, and sex workers internally within TAC. The women's sector will focus on the following: pushing for the rapid resolution of contraceptive stockouts across South Africa, advocating for access to sexual and reproductive health and rights services and leading programs related to this, supporting efforts to dismantle sexism and misogyny internally within TAC. The youth sector will focus on the following: pushing for young people to be offered PrEP and for multi-month dispensing a community collection of PrEP, advocating for HIV prevention measures, including easy access to internal, external condoms in schools, comprehensive sexuality education in schools, advocating for youth-friendly sexual and reproductive health services at health facilities. The men's sector will focus on the following: pushing for public healthcare facilities to have male clinic days and men's corners integrated into service delivery to provide services specific to the needs of men, understanding and addressing the issues of privilege, gender discrimination, patriarchy, homophobia, and transphobia, and all other oppressions perpetuated by men within TAC structures.
Thank you. Any addition from the policy part? Additions? Comments? Going once? Going twice? It's closed. Any opposition? Any province opposing? Thank you. Can continue, lots.
Go up a bit, please. On the resolution committee, number 70, recognizing the potential of key resolutions not to be implemented, TAC will establish a resolution committee which will monitor implementation of Congress and NC resolutions periodically.
Additions? Opposition? Thank you.
Okay, on resolution 71 is on membership. It says, members of TAC shall include any natural or legal person, irrespective of their age, gender, creed, nationality, or race, who supports the aims, objectives, and policies of TAC and are accepted as members in terms of the provisions of this constitution. However, only persons 13 years and above can stand for and vote for elections. Resolution 72, a TAC branch must be constituted by more than 50 paid-up members to be accredited. Resolution 73, while membership subscription fees are annual, members and prospective members willing to pay multi-year fees should be encouraged to do so.
Thank you. Any additions? Additions? Western Cape?
Thank you, Chairperson. As Western Cape, we propose that TAC branch should at least be constituted by 30 paid-up members. Thank you.
Thank you. That's a proposal from Western Cape. Gauteng? Free State? When I call you, comrades, can you go to the mic?
No, I just wanted to request that we be, we limit the years in which one can pay as a multiple payment for subscription for years.
So that is another issue.
So we can then propose that per term. If he's paying for membership, we can say 2 years, or 5 years. But this cover multiple because someone can pay for 10 years and all that. So let's have a limitation.
Okay. Free State?
Thank you. Yeah, I'm on that one of 30 members. I think we once agreed on this 50 paid-up members. Then we struggled at branches. But after yesterday, considering the age that is needed, I don't think we'll even go beyond 50. Why I'm saying that is that because before the age restriction, there were too many youth members who wanted to join us. So on that note, I think we should stick on 50.
So there are two proposals on the table. I see you, Chairs. Sondel. So there are two proposals on the issues of TAC membership. Western Cape proposes that it should be 30. Western Cape proposes that it should be, we should leave it at 50. So I want to tell us to deal with that matter first. Yes, Chairs.
As I speak now, I think about 60% of the branches in Limpopo are already at 50 and above. When you go to Eastern Cape, about 30% of the branches in Eastern Cape are already at 50 and above, and in other provinces. So, based on that, I fully support what is recommended on Resolution 72. Thank you.
Thank you. So the GS supports the Resolution 72 to be as it is. Can I see by show of placards the provinces that supports 50? Limpopo, Eastern Cape, Free State. Gauteng, I'm not sure whether we raise it or not. Okay, I said only those who are supporting, can they, not, because we are voting now. Can we raise again? Limpopo, Eastern Cape, Free State. Those are 3 provinces, 4 with the GS. Fela, your vote counts, yeah. He's a voting member. He's a voting member. His vote counts. 4. Okay? Those who are supporting 30. 1 Patrick, 2 KwaZulu-Natal, 3 Western Cape, 4 Mpumalanga, 5 Gauteng. So it means we stick with 30.
Okay.
Okay. Now, there was another, comrades. Comrades, can we respect the Congress? I don't think we need to discuss this. Provinces have voted. Yeah. And everyone was given a fair chance. Not unless people were not given a fair chance. So, there's a proposal that membership on resolution 73 to say instead of saying just multi-years fees, it should be limited. They suggested it was 3 or 5 years. So I'm not sure which one are we going with. Which proposal provinces think? KwaZulu-Natal? Sukuma phela KwaZulu-Natal, Eastern Cape and Western Cape. Free State?
See, proposal 3 years because 5 years they got too much.
Okay, 3 years?
Short Chair, I think Tina as Eastern Cape are proposing 5 years.
5 years?
5 years, yes.
To tie? Western Cape?
Ngosi Chair, as Western Cape, we also propose with 3 years. Ngosi.
Okay. Free State?
I agree with 3 years.
3 years? Mpumalanga?
We are proposing 3 years.
So it means 3 years goes. So it should be limited to 3 years. Andizukontinue abantu basaxoxa. Zabalinda bagqibe.
Yes.
Zabalinda bagqibe. Because I think if a person wants to say something, needs to raise their hands or raise their paws. So with the Limpopo?
I am not here to decline, Anne. I said, but given the chance, if we agree with 3 years, it is right, Anne. But the fact of ukuthi umuntu munhu ala ku hakela ya lembe anu kombela ku ai kombela ku na yena a pfumeleleriwa o hakela kusuka ka 1 year to 3 years leyi va hi vulaka leswi hi kombela swona
that hi swona leswi va swi vulavulaka
hi swona ni
hi swona.
ro 1 to 3
yes yeah
Okay.
So with additions, are we happy with those resolutions, comrades? Any province opposing? Western Cape, I'm not sure. Are you raising on a point of order?
No, Chair, I'm sorry, I'm not opposing. While we are on this issue of a membership, I wanted to propose, since we know that a membership, it be 20 rand, I wanted for it to be 30 rand. That's my proposal, Western Cape.
Okay, comrades, high moral, high discipline. We don't howl at each other, comrades. That is disrespect. When we have another view from what a person is saying, we raise a placard and we are given a chance to speak, other than howling at each other. GS. Eastern Cape. Sukuma sisiyo emva kwa-GS.
Comrades, I want to say in South Africa, we've got many challenges. One of those challenges is unemployment rate, is poverty and many things. So I will humbly appeal to the Congress that we remain at 20 rands subscription fees. Thank you.
So, I hear people are clapping hands, but I'm not sure. KwaZulu Natal, are you raising on a point? Or you are supporting the 20 rands? So, can a show of boards, comrades, see how many provinces are supporting 20 rands? Limpopo, Eastern Cape, Mpumalanga, Free State, Gauteng, KwaZulu Natal. Thank you. Northwest, and vote. Okay, so is this Open Congress adopting these resolutions? Yes, thank you.
Okay. So we move on to numbers. Resolution 74 on branches.
Comrades, please. You're chowing time, comrades.
The TAC National Council is mandated to create a demarcation committee that will evaluate the feasibility of potential branches close to each other in order to ensure that they do not result in duplication of work and conflict.
Any additions from this? 74, resolution 74. Can you go down to 74, please? Can we go up to 74? Any additions, comrades? No additions? Any opposition? Limpopo?
Comrade, mina liya naitwa le bayibulako. Mara as hi kha hi ri na challenge la ka TAC na challenge financial ani ti branch tin'wana ti ngo va kusuhi na kusuhi ku fana no nyika xikombiso hina Ilim Magangeni, it's not far ani mara loko hi teka hi ku Ilim ya cater na ti village tin'wana ti nga le and loko ho va veka ndhawu yin'we most of the time comrade loko va fanele va ya ka branch leyin'wana va ta fanele va khandziya a ni kombela ku va yi langutisisa liya and na ku loko tin'wana ti endliwa ti-branch ti ri kusuhi na kusuhi hi langutini ku maybe ti-health facilities ti kona laya kwalaha va nga kona se mina na hi vona a ni yi kaneti mara a no vulela ku swi ta tlhela swi vuya swi straina ka hina loko ti katsiwa ivi swi fana na timhaka ta mali ani and ni pfumela ku ti-branch leti loko ti pfuriwa yin'wana na yin'wana ti na laha ti tirhelaka kona a va tlachi a ni tivi loko ku ve ni ku na leti ka ti-province ti tlachaka hi mintirho mara ti va ti ri kusuhi na kusuhi ti pfuriwe a ti tlachi se a ni na ku ta ku mi yi languta ku yi nga tlhela yi va na challenge mi kuma ku vanhu se va nyama hi mhaka ya ku va ti byela ku hi nge fambi kunene as wa volunteering ani va tiva ku hi nge fambi kunene hi milenge yaleyo hi nge swi koti hi nge tirhisi we can't use our own transport to get there while we are volunteering so a ni languta ku mi yi languta kahle yaleyo.
Okay, I think Comrade Mavi, this resolution, it addresses what you are saying. To say that the demarcation committee will look at the area to say, Elim, because you cover these areas, you need to work on these areas. And then Makangeni, because you cover these areas, then you work on this community. And then if there is a clinic in that community and this in that community, they also be allowed to do so. Shafamban. Okay, we can move.
Okay, comrades, so then we're moving on to DCTs. And this is resolution 75. This is mainly changing language from chairpersons forums to DCTs. So it says, district campaign teams will replace chairpersons forums as a focal point of inter-branch engagement, mobilization, and activism. These will be constituted by branch chairpersons, secretaries, other branch members, Richidze, and partner organizations deemed fit from accredited branches in the same district.
Okay, resolution 75. Any additions? Limpopo?
Edala, what about a provincial chairperson and provincial secretary to be part of the DCT teams?
Okay. Limpopo is suggesting that provincial chairperson and provincial secretary to be part of the DCT teams. GS?
If I understand this resolution is actually saying the district campaign teams are replacing the chairpersons forum. So in the chairpersons forum, it was only branch chairpersons who comes from all the branches under the same district. But simply because we took a resolution that provincial secretaries become full-time members of the National Council. Therefore, we need to make an arrangement for branch secretaries to be included in those chairpersons forum. But now what we are changing is the name from the chairpersons forum to district campaign teams, which will include branch secretaries as well as other partners that we are working with at the district level. If we are to include provincial chairpersons, I'm asking myself, what will happen in the event one province has about 6 districts? Does it mean the chairpersons of the province will sit in all the district campaign teams and also lead the provincial council meetings? So I suggest that let it be like this and let the provincial leadership take a lead on provincial issues whilst branch chairpersons, branch secretaries, and other partners that we are working with at the district level are taking a leadership. Thank you.
Thank you. There are 2 suggested views. Comrade Patrick?
Congress, I'm not actually in disagreement. Oh, sorry. No, Chairperson, actually, I'm not in disagreement with this arrangement, but only one party is a question then who lead this particular structure? Who chairs it? Is it a chairperson? Is it a staff? Who chairs it? If you can just sort that part, I think, so that we be a misunderstanding also. Thanks.
Okay. Do you want to come back, Jess? Okay.
I think the first question that we must ask ourselves, who was sharing the chairpersons forum? The chairpersons. And can I be protected, chairperson?
You're protected against.
And also, from the little knowledge I have, chairpersons forum are not a platform to discuss constitutional matters, where a chairpersons forum will take a decision and go to the provincial council and say, we as the chairpersons forum, we have decided this. Chairpersons forum was a platform for branches coming under the same district to be able to discuss issues around advocacy and campaigns that they can drive together. And those chairpersons forums were supported by district organizers and community advocates of TAC, because at the end of the day, it's not about writing minutes of the chairpersons forum, submitting them to the provincial council. All structures of TAC, all branches are accountable at the end of the day to the provincial council. So now, if we're gonna say the district campaign teams must have our chairpersons, we might be losing it, because those platforms are all about advocacy and campaign issues. So, thank you, Chairperson.
Thank you. Is it clear, Comrade Patrick? Okay. So, is it clear for all of us, comrades? There are no other additions, I mean to say. Senkatel. Any opposition? None? Can we move?
Okay, comrades, we're going to go faster so that we can catch the light for the photograph. Resolution 76 is on the National Council. The TAC National Council shall consist of not more than 40 people.
Any additions? Opposition? I'm not going to recognize your hand because you raise your hand. We raise the boards, not the hands. Gauteng.
Key question pertaining that there are not less than 40 people ne go National Council. So my question will be, before we take on that, how many people are there in the National Council? If that resolution says not less than 40, how many people?
Not
are
more
there?
than 40.
Yes, not more than 40. So the question is, how many people are sitting in the National Council now? What I'm trying to say, that commission, Comrades Bongile, were supposed to be guided, or in the National Council, we are 5 or we are 10. I submit.
I'm not going to allow discussion here, comrades. I think we are exposing ourselves. We are hanging our dirty linen on the public. That's what we do. So I'm not going to give a Congress space to discuss that because we are questioning ourselves. Not unless I'm out of order. I'm out of order, Jess? Okay.
Chairperson, with all due respect, I think we need to allow the Congress to deliberate on this because this is a proposal from a commission. And in order for it to be incorporated as a resolution, decisions has to be taken by this parliament. Comrades, we need to read the constitution of TAC so that when we come here, we don't come here to expose ourselves. The TAC constitution says, National Council shall not be constituted by more than 30 people. That's what the constitution says. So now, in September last year, we took a resolution that provincial secretaries will form part of the National Council. Therefore, it means if we are adding provincial secretaries, the number might go to be more than 30. That's why we are proposing that National Council shall consist of not more than 40 people. Thank you, Chairperson.
Thank you. But also, comrades, I think we are not doing justice to this Congress because commissions came and reported and we were afforded an opportunity to ask questions. So we cannot rediscuss the very same things that we discussed. I think we are deliberating, chowing time. Instead of us questioning the things that we have discussed, rather we come with propositions to say what do we propose.
Point of correction, Chairperson. Yesterday, when commissions came back to report, we were told that we are not going to discuss these resolutions as they were presented. We're going to discuss them today. So I think we've got all the right to discuss these resolutions because as they stand now, they are still proposals because we were never afforded an opportunity. Yes, Chairperson. All commissions, when they went to report, they made an announcement that we will only make inputs and discussions today.
I think, comrades, Comrade GS, you're out of order. Comrades, when they were reporting yesterday, they reported and there was additions from the commissions and there were the additions and there was questions to say any clarity seeking questions. Comrades were asking questions. And we were in the same room. So all commissioned work discussed. The only thing we resolved on is that we are not going to adopt them yesterday because they are still need to be drafted in a final version. So for us today is to go through them and see whether they are captured as we have discussed them. Not to discuss them. So, because of time, comrades, we're part of the commissions. The commissions reported, and the additions were made, and the discussion were done. So, I'll suppress you, Comrade GS, so that we continue with the Congress. I don't want us to have bilaterals, and I need to give clear direction to the Congress as mandated to lead this Congress. Thank you. I'm not sure how whether you are raising on a point of order. Thank you. Any supporters of the resolution 76? Eastern Cape, Free State, Mpumalanga, Limpopo, Western Cape, KwaZulu-Natal. Thank you.
Okay, thank you, Chairperson. On national office bearers, there were two resolutions. Resolution 77, which came out of the constitutional amendments, was the DGS position will be a paid position depending on the availability of sustained funding for, sorry, I thought that someone was raising their hand already. The DGS position will be a paid position depending on the availability of sustainable funding within the organization. 78, the DGS will focus on building and maintaining a second and third layer of leadership within the organization. This includes ensuring the building of a cadre that is informed, theoretically aware, and able to articulate issues related to the organization, as was once the case.
Resolution 77 and 78. Additions. Okay, Comrade RGS.
I'm worried because we will seem as if we are not consistent if we're going to discuss other resolutions and not discuss others. I do not know whether must I discuss or must I come and just oppose or support, Chairperson. I do not know.
Oppose and give your reasons. Or support and give your reasons.
Okay. If we turn to page 11, clause 9.5 of TAC Constitution. Do we have it?
I have it.
Unfortunately, I'm not good at reading.
You want me to read it?
I can't see properly.
Do you want me to? Let me wear my glasses, I can read it. Is it this one? I think I've got it here. 9.5. No liters. Yeah, no. Yeah, that's the one. Okay. Comments, I think the GS is revising his point.
My apologies. Sorry, comrades, it's page 17, 14.8. My apologies. Page 17, clause 14.8.
Okay, so do you want me to read it?
Yes, please.
It says, all national office bearer members are expected to maintain a professional standard that respects confidentiality of sensitive issues in policy, leadership, and staff. National office bearers should not hold any paid position within the structures of TAC other than the General Secretary of the TAC.
Thank you.
Is that the one? Yeah.
Thank you. So, can I proceed? Just a public disclaimer. Unfortunately, the proceedings of the Congress made us to be where we are still discussing resolutions after the leadership has been announced. This has nothing to do with Patrick Mdletshe. It has something to do with the policy position of the organization. So I so wish that what I'm raising here is not going to be misinterpreted. In 2012, I still remember vividly, Noloyiso, you were still the provincial manager, coordinator of Eastern Cape. I was the deputy chairperson of Eastern Cape. Because of the financial situation of TAC, 2012, we took a resolution that the position of the deputy general secretary, who then was Comrade Lihle Dlamini, who was responsible for a capacity building, we resolved, and I think myself and Comrade Patrick Mdletshe, we supported that motion and Sibongile Chabalala because the three of us, we were the provincial chairpersons. We took a resolution that the DGS position is not going to be a paid position because of the financial situation of the organization. The question now that I want to ask, has the financial situation of the organization changed? Are we in a right financial situation now that will make us to advance that resolution? 2, last year, myself and the chairperson of TAC, we went to the board of directors of TAC to beg them that the workload on our shoulders is too heavy. And we want someone who is going to come and build the capacity of TAC members. So the question that I'm asking is twofold. One is based on what is on clause 14.8 and based on what is already existing. Thank you.
Thank you. Eastern Cape, Gauteng.
Molweni, ndizocela ukuthetha isiXhosa ndizoziva. Ndiyayiva i-point ka-GS. However, I'm concerned that this is the document that we've discussed at the branching. And the question that the question was raised with discussion document was that the DGS position should be paid. And then we discussed, we went to a branching and the branch members took a decision to say yes. And I think if I look at, for example, Eastern Cape, because we have to go back and report, is that they were also had, when they submitted, they had also a suggestion of what is it that needs to be done. But I think it's something that we should then see it, because I don't know why was it then added on the discussion document if it's something that is also, we knew that we've got a challenge here.
Thank you. Eastern Cape, Gauteng.
Yeah, thank you very much, Chairperson. Thank you, GS, for highlighting that critical point, which we never really considered when we took a resolution from the branch. I stand to provide advice because this is a national Congress. This is where the highest decisions are made. Therefore, my advice then shall be, in respect to point 24, 24.1.5 of the Constitution, which reads that if we had an ambition to amend the 14.8, we should have wrote for consideration to the National General Secretary so that this Congress is able to can have discussion on that matter.
Comrade Bobby, I'm sorry, my leader. I didn't get you. What you said? What page?
24.
Oh, I'm reading to Constitution, National Congress Proceedings,
Okay.
24.1.5, which reads, consider, the National Congress shall consider any notice of motion which has been submitted to the General Secretary in writing at least 2 weeks prior to the Congress.
Okay.
I'm raising that point because there might be an ambition. Obviously, there is an ambition that we amend 14.8, which GS just mentioned here, that is preventing us to can continue in adopting the resolution 77. So then my advice and proposal is that this Congress take a resolution again to, I'm not absentia of any other way, to suspend this matter, to afford branches to follow the procedure, and then we give powers to the National Council to decide on the motion to amend section 14.8 of TAC Constitution. I submit.
Then, thank you, Comrade from Gauteng. I see a board from Reza Pelagakul. I am Zam. Reza Airport, Eastern Cape. If you put as a KZN, then why logo ni lati port yan KZN? KwaZulu Natal. Comrades, before, as you taking the podium, can Comrade Akona refer to the page where there is this proposal on the discussion document?
Ikon.
I just need a page. I think I missed it.
Constitutional amendments, first page of the constitutional amendment.
Oh, okay, I see it now, Comrade. I see it, sorry. Thank you. Okay, you can continue.
Thank you so much.
Sorry, Comrade. Comrade, I'm chairing. So I cannot preside over something I understand. I need to see so that.
Thank you very
I'll be
much,
in line. Thank
Chairperson,
you.
for affording me the opportunity. I just want to first concur with the last speaker in this item that this matter be stand down for further engagements and discussions around it and at a provincial level. Coming to the question that was raised by General Secretary in terms of financial stability of the organization. With the finances that were presented in this Congress, it has been evident that the organization is sitting with a deficit. So what does that simply mean to this particular proposal? It simply means that we cannot afford, by any chance, to have that particular position being a paid position. Despite all of that, you'll remember, just to share, while I was still a board member, the organization took a decision, a conscious decision, to say let us freeze other posts or positions within the organization. It's not a matter of that we do not want to employ people, but it's a matter of the financial pressure that the organization is faced with. I thank you.
Thank you. Comrade.
Angbonge Sal. I think that resolution 77, there is a key word. I read, it says, the Deputy General Secretary position will be a paid position. Myself going to a key word, depending on the availability of sustained funding within the organization. So that resolution has a key word. And I think if we read that sentence carefully, because it's very clear, that key word is saying depending. You know, currently, the situation in the organization, taking from previous engagements and discussions in this Congress, it said the situation, that key word depending, I think it helped us to take a key decision that depending, so the National Council should then meet to look at that keyword. Then resolutions and solutions will then be taken by the National Council. Thank you, comrades.
Thank you. So, comrades, there are two motions here, if I get it right. There's a motion from Gauteng that says this matter should be taken back to the branches of TAC. And there's a motion that says because there is a pending wait to on the availability, we should leave it like that. So can the Congress guide to say what is the position? GS? Limpopo? Gauteng?
Chairperson and the Congress, I want to fuse the two proposals into one proposal. I agree with Comrade Upopi from Gauteng. I agree with Comrade Umzamo from KwaZulu-Natal that from this Congress, when we close this Congress, let branch leaders go back to branches and discuss this matter. Then after discussing it, they must submit their decisions to the provincial leadership so that when we convene the first National Council meeting, provinces will have received inputs from the branches and carry the mandate of the provinces to the National Council. I thank you.
So by the show of votes, Limpopo? Seconds. Limpopo seconds the motion. Mpumalanga seconds. Gauteng seconds. Free State seconds. KwaZulu-Natal, Western Cape. Only and men's sector. Oh, I thought you are opposing Eastern Cape. Okay, thank you. So can we move? So we are, that means, comrades, when we go to resolution number 78, the DGS will focus on building and maintaining the second layer of leadership within the organization. This includes ensuring the building of cadre that is informed theoretically, aware and able to articulate issues related to the organization as once was the case. What are we saying about this resolution? So, as we are saying this 77 we are putting on pause, so I want a clarity to say, what are we saying with resolution number 78? Comrade GS, Gauteng, Western Cape, Mpumalanga.
Chairperson and the Congress, I thought that, or I proposed that, all resolution 77 and 78, they must go together. Thank you.
Thank you. Gauteng. Comrades, can we try to save time? You are not saving time, man, identify and comrade.
Oh, okay. No, thanks. We are saving time, Nkokeli. Yes, I think we do, agree with the previous speakers that this matter should go back to the branches so that we seek a new mandate. Because as we are here, the mandates seem to be changing and we still have to go and get a fresh mandate. Otherwise, we'll be theorizing and the branches will feel defeated. Therefore, we can't take decisions on behalf of the branches without their expression having to be part of this Congress. Thank you very much. I hope I...
Thank you. Western Cape.
Ngosi Chairperson, resolution 78. Sine proposal of Western Cape, ne? Seeing that 77 will be deliberated through the branches. 78 yena we propose indobana can be resoluted in this Congress, even though they are similar, but they are not the same. Another clarity from the second sentence, 78, it read as this includes ensuring the
building of CADA that is
yeah.
informed.
I'd like clarity when I chair, is it referred to a singular or a plural? Thank you very much.
Unfortunately, comrade, chairperson from Western Cape, I cannot discuss English here. And I don't think we are in an English class. So when we are talking about CADA, we are talking about comrades. Irrespective whether it's one or two, but the responsibility of the General Secretary is to build the second layer of leadership. This includes building a CADA that is informed. So each member joins TAC individually. We are a comrade. So sonke we need to be informed. So class in English, comrade. So the proposal from Western Cape, it says it should stay like that, and this should be the responsibility of the Deputy General Secretary. KwaZulu-Natal?
Thank you, Chairperson. We're in support of the motion of submitted by the GS saying that resolution points 77 and 78, we take them back to provinces.
So KZN supports the GS, Limpopo supports the GS, Mpumalanga, Eastern Cape, Free State and Gauteng. So those are the provinces. So it means by majority, we'll take that, we'll refer that back to branches.
Sorry, I'm just making
the notes.
My notes, yes. Show my leader.
Sure. Comrades.
So we're on number 79. Three more left, comrades. Number 79 is on termination of office. It speaks and says, the termination of office of elected individual leaders will occur for those who fail to attend 3 consecutive meetings or are deemed unfit through an evaluation system. Number 80, it says, the TAC National Congress recommends that the TAC board should be given powers to dissolve the NWC if it fails to deliver on its responsibilities based on an agreed upon evaluation system. Prior.
Yeah. Those resolutions, any additions? Eastern Cape?
Ngizocela ukuxolisa because I know ukuthi kwi group basically ngeke ndayibuza lo mbuzo but ngifuna ubuza la in the Congress. For example, I'm going to make myself an example ngam that I belong to Emevana branch. But now currently I'm working at the BCM. But in BCM I attend in New Life branch and I write Emevana. And now if I'm unable to attend a meeting as Ntatu, is it going to be a problem? Okanye, how do I resolve that?
Okay. Gauteng, KwaZulu-Natal, and GS. Okay, let me say this. Gauteng, KwaZulu-Natal, Mpumalanga, DGS and GS. In that particular order, comrades, can we be nearer to our...
Resolution 80, Gauteng is opposing the proposal based on the fundamental matter and factor that the Constitution says it all, that the branch is the brain and the heart of the organization. The branches are the ones that elect the National Working Committee. Therefore, the branches must be the ones to be given power to dissolve those that they have elected. So, as recommending the board is not an order. Therefore, we oppose. Thanks.
Thank you. KwaZulu Natal. Aibo, comrades, Kosi. Singamaslow learner yini kanti.
Sorry.
Mpumalanga ngicela ube on standby.
Comrade Chairperson, I was covered by the last speaker.
Okay. Thank you. DGS Zokaban.
As Pumalanga, we support what Gauteng has said because these people are put into position by us, the branch members, not the National Board Council.
Thank you. 3 provinces supports. Limpopo also says they are supporting this motion. DGS?
Actually, I'm funuguti we support or not. Nifila sengati we are misappropriating the power of the NWC and the Congress. Congress and NWC do have those rights, either through special AGMs or either through a National Congress. Otherwise, then in another way, this is what we are insinuating, that the board do have a power of removing actually everyone whenever they want to or whenever they wish to. I think
in support of Gauteng.
Yes.
Just awufuna ukusho nje ukuthi we are supporting the provinces. Hlala phansi comrade Mdletshe. GS.
Thank you. Thank you. So, the question came yesterday that the Provincial Working Committee has the powers to dissolve a branch that is not performing. It's in the Constitution. The National Council has the powers to dissolve a province that is not performing. And the question was, who dissolves a National Working Committee when, Chairperson?
Sizomkhiphela ngaphandle uDGS ukuthi uqeda ukukhethwa kunandaba.
So the question came as to say, who dissolves the National Working Committee when it is underperforming? Also, if we read this resolution, it talks about a performance evaluation of the elected structures. The question came, if the province is going to do a performance evaluation of the branches, and the national does a performance evaluation of the provinces, who does a performance evaluation of the National Working Committee? So that's why we were sponsored with that proposed resolution. But if the Congress feels to say the National Working Committee and the National Council must evaluate itself, then I support that as well. Thank you.
The question will be critical to ourselves now. Yeah. So, yeah, ningixakile ke manje comrades. Ningimisa inhloko. But this motion was supported by Limpopo, Gauteng, there were 4, DGS. So, comrades, are we still digesting what DGS just said now? So what do we need to do? Do we refer this back to the branches? So what do we do? Okay, you want us to vote on 2 motions. Can we vote then? To say, are we saying the National Working Committee and the National Congress, they need to take a responsibility, or we give it back to the branches to evaluate the National Working Committee? I'm not sure how we want to put it. I want us to put it in the right way. I'm trying to understand it in my mind. Can you go to the mic, Comrade Bob? Yes, comrade, can you go after Bobby? Gauteng has 2 comments.
Yeah, I think first, Comrade Anela is making a mistake to say that the national, and it's deliberately confusing himself. He knows the fact. This is where we evaluate the work of National Working Committee. Here, at the Congress. It's not like there's no platform where National Working Committee is being evaluated on their performance. That is why every Congress, we check the resolutions of the previous Congress, how far are we, then we take the new marching orders. So the Congress and National the orders. Last point, the reason I'm saying we take a decision here and not take this matter back, and not take this matter back.
Before you move, Comrade Bobby, from the... Oh, sorry. Before you move from the podium there, I want to check. Kangane GS, I noted you. I want to check, based on the last situation of what was happening. I think all of us, we know the challenges of the National Working Committee. And the challenges of the National Working Committee were tabled to the National Council several times, which is the highest decision body in between Congresses. And the National Council failed to support NWC. So, by saying what you are saying, you mean even if there is one comrade who's left, other comrades who are bench warmers, who will continue to abuse that comrade or one or sebenzayo just because the comrade is pushing. The National Working Committee shouldn't be evaluated while we are talking about provinces needs to be evaluated. So where is equality in terms of that? And what do we say to the organization? Because if I'm failing and the National Council is not saying anything, I'll continue to warm this bench for the next 5 years. But other people will carry my burden. Like, for instance, I just want to put facts, comrades. I know, I'm out of order. Okay, if I'm not out of order, as a voting member, can I be also given a chance? Like, for instance, a typical example. We had about 4 years, 3 to 4 years, without men's sector, without women's sector. We discuss and say, go back to branches. They come the next council, only one province consulted. They come the next council, only 2 provinces they've consulted. They never did. So the National Council, as the highest decision body, it means it can take this organization to the drain without anyone saying anything. That's what we are saying as this Congress. Or the National Council, who's overseeing what the National Council is doing and how is it performing. If the National Council, it doesn't perform its duties, because as per experience, the members of TAC failed to hold the National Council of TAC accountable and failed to hold National Working Committee accountable in the last term. So moving forward, we'll continue with that problem. Or what do we do? Okay, I will give you Comrade Bobby, GS, be on standby. It will be Bobby, and then that comrade, Eastern Cape.
All right, thank you very much. I still want to sustain the point that the brain and the heart and the DNA of the organization called Treatment Action Campaign, this revolutionary movement, is branches. There are 3 things that I will want to really mention as part of my background. That one, there's a National Congress, and the Constitution is assisting us. National Congress, there's National Working Committee, there's National Council. So, the National Congress, of course, I know you know leadership, that it is the one that is very much the arbiter of the organization. Then the arbiter elects the working committee to implement the decisions of the arbiter. Then the arbiter, obviously, has the powers that they have. Then the working committee, which is the ones that we have elected here. Then there is a NC, which includes the provinces. So my point in responding to you is, we understand that we are an organization that its power is centralized. However, we need to acknowledge one, Resolution 77 and 78, in fact 78, which is going to assist to arrest the problem that we encountered before, that branches were not doing what is expected of them, so that they are able to can execute their powers to amend or to change the, certain situations that are occurring nationally. There is no way in the constitution of the TAC now that affords a power to a board anywhere for, inside the political discussions of the organization. There are two forces here, which is MOI and the Constitution. We are guided by the Constitution of the organization. And the Constitution is giving the arbiter, the National Congress. Legally, board. But in terms of power, there is separation of power. That is why we have the National Chairperson. Thanks.
Okay. Enkosi mhlali ngaphambili. Mna ndicinga into kubana i-National Council ayikwazi ukuzi-evaluate ngokwayo. There's no way ukuthi bazi-evaluate ngokwabo. There should be somebody above bona ozokuthi aba-evaluate. That's my submission.
Thank you. Yeah, Eastern Cape and then GS.
Oh, Eastern Cape and then GS.
Eastern Cape and then GS. Eastern Cape after Eastern Cape.
What's the Eastern Cape? You sorry. Thank you, Chair. One, I think, Chair, it is very fundamental of us, it is very fundamental of the National Council to draft, maybe on a 3-month basis, a report in terms of the performance of the structure at large, so that it can entail that Uvuyani in the NWC is just a benchwarmer. His performance is poor. I'm not sure. No, we are in London, Chair. Oh, okay. To Chair, I want to say, obviously, Lendo is our 30 Suez branching. Branches will decide, but it will be relayed through provinces. Branches will make their submissions to the province, then the province shall relay the message. If the provinces, maybe let's say we have 9 provinces, for an example, if 5 provinces agree to this motion that the NWC must be dissolved, when the NC must be dissolved, then that will be the case.
Okay.
Yes, I think the land is
Chairperson in the Congress, I've got 2 issues. The first issue, I want to correct to Comrade to Bobby, and the second issue, I want to sponsor a proposal. If we turn to page 11 of the TAC Constitution, clause 9.1, Comrade Bobby said here, there is nowhere in the TAC Constitution except in the MOI where it talks about the powers of the board. I want to correct Comrade Bobby on that. It reads as follows, 9.1, subject to powers conferred on the board of directors by the Memorandum of Incorporation. The National Council is the highest political decision-making body between congresses. So, as much as the National Council in between congresses is able to take decisions, but if those decisions are not in the best interest of TAC, the board of directors, according to the Constitution, has the powers to turn down those whatever resolution that has been taken by the National Council. So, Comrade Bobby is misinterpreting the TAC Constitution when he says there is nowhere in the Constitution where it talks about the powers of the board. But, Chairperson,
No.
I don't know that I'm out of order. Or.
Okay, to the point, to Lelana comrade. You cannot raise a point of order and then umela pume kon. Angeng login fundi sinto iwan ganing ning.
Thank you very much, Chairperson. I take note of the 9.1 which you are mentioning of the Constitution. I wish to also refer you to the Constitution, number 25. I'm not sure of the page in the small one, but I want to refer you to 25.1 of the Constitution, which is very much clear and ensuring that it separates the power from the Constitution and MIO. It reads, the business and affairs of TAC shall be managed and supervised by the independent directors and the 3 office bearers from the National Council. Together they shall form the board of directors of TAC, which may exercise all the powers of the company and shall have full powers of administration in respect of company, as envisaged in terms of Section 66.1 of the Companies Act. It gives powers to the board administratively, not in terms of governance. In terms of governance, it is not having power, the board, to can come here and tell us not who to appoint, which decision not to take and all that. So I'm saying there's contradiction of what I'm being referred to and what I've just raised. Thanks.
Can I proceed?
You can proceed, comrade. Daniel.
Comrades, one good thing that I like about TAC is a school. Is a school, and also history does not have blank pages.
Yes.
2013, the General Secretary of TAC resigned. And I was the acting chairperson of TAC then. In February 2014, we convened a special National Council meeting where a decision was taken that, Comrade Aneleao, you must be an acting GS until the final approval of the board. Am I lying? Noloyiso, Patrick Mzamu, Sbongile?
No, we are not
So,
lying.
why did the National Council took that decision? It is because the National Council knew and understood the legal powers of the board in terms of a memorandum of incorporation. If the National Council in 2014 never knew and understood the powers of the board, we would have elected the General Secretary immediately and not wait for the final approval of the board. So, Comrade Tupopi, I still maintain, is misleading the Congress on this note that a board does not have powers. I just said here, we went to the board to tell them about our frustrations. The board took a resolution that we can hire someone who is going to support the governance. So the powers of the board are not limited, comrades. But what I'm trying to say, Chairperson, based on the proposal of Comrade Tupopi and the support of other comrades, I fully support that we remove Resolution 8 with Indo 8. The National Working Committee will have powers to evaluate the performance of the lower structures, and nobody will evaluate the performance of the National Working Committee. I support that. We remove that resolution. Thank you.
Gauteng, DGS. I'm not sure whether Comrade Bob is the only comrade in Gauteng. He's the only one? Okay.
Two things which I will really want to raise. Unless if I'm misled, that the General Secretary administratively behaves as CEO, or he becomes the CEO of the organization administratively. That is why it's critical that we always have that person in place. That is why the board then had the power to have somebody acting. Secondly, Comrade Ainele must not be emotional. He must calm down.
Who's a man's chief?
He must drink water. we have seen this point again. The National Working Committee, its work is evaluated here. That is why we elect or re-elect according to your performance or value to the organization here. So he must not make as if there's no platform
Bobby.
where we do not measure the performance
Comrade
of working
Bobby.
committee.
Comrade Bobby.
So he must just agree with us.
Comrade Bobby, in between congresses, who holds the National Working Committee accountable?
In between congresses.
In between congresses,
Yes.
who holds the National Working Committee accountable? Tula Patrick,
All right.
uneindaba zakho kufanele uyiphendule.
The unfortunate thing is that the constitution of the same organization does not afford us to have something that we call, normally political parties, they call it policy conferencing, or NGCs, they call it NGCs. That's where they are measured, the national. So I'm saying, unfortunately, we do not have that. We have only one chance to monitor the performance of NWC, and that is every time when the term ends. And this is
Thank you, Comrade Bobby. Comrade DGS. Thank you, Comrade Bobby. Your point is made. Comrade DGS, before you speak, you know, this discussion, as per resolution 78, it gives you a mandate to go and do what the resolution 78 says. Because what the comrade is saying, I like this discussion, and this is nice because we are open, we are talking. The comrade is saying we should disregard National Council in between congresses and wait for the National Congress to come and evaluate the National Working Committee. So it means if, as per Constitution, if we don't have funds to consume congresses, if the leadership is sitting for 10 years, we will sit for 10 years on positions and nobody will question the chairperson. What we are trying to say, or what I'm trying to say, comrades, check the dangers. Don't open the gaps for National Working Committee to become bosses of TAC. Because what you are trying to do now, you are giving the National Working Committee too much powers. And we will go and exercise these powers. And these powers that you are providing to the National Working Committee will destroy TAC. If you are not thinking through this resolution, this is very critical. It's very critical because the power, the survival, and the death of TAC is sitting there. So this means, the way you put it, comrades, it means I can come to provinces and do as I like. I will not be, no one will say anything until the next Congress. That's what you are saying. That's how you want us to put it. You are saying the Congress is the one that evaluates the NWC. So if there are no resources in the organization, or there are no means of getting resources, and the power that is given to the NWC, we will enjoy the right. And no one will hold the NWC accountable to say your term of office has ended. Who are you? The Constitution gives us power until the next Congress. So the next Congress is not yet here. Keep quiet, Chief, and Salalap. We'll drive this ship to our own direction. Kahle, kahle. That's what it says. That's what this Congress says. So, I'm not trying to convince comrades, but I'm trying to explain what we are saying. And alert you of the problem you're creating. But again,
Thank you,
Ilele
Chairperson.
again.
Okay.
After GGS Eastern Cape,
the way is almost we are deviating to this resolution, I don't even know anymore what are we actually talking about. But I think we are clear there must be a power separation between the board and TAC as an organization. Hence, we are a mass movement organization. We have e-Congress. Below than that, between the Congress, people that are making decisions, in National Council. And then people that are working throughout until the next council is a National Working Committee. I think the problem here in this, it's a question of who actually evaluate the work of NWC. No, let's not mix them. We need to remove that part of the National Council because in National Council are the members, are the chairpersons that are coming from the provinces. Maybe let me take you down to the memory lane. Ne? Yes. Let me take you down to the memory lane then. It is not new in TAC of having something that is called National Working Committee evaluating, National Working NWC evaluating committee. There's nothing new in that. It's just that in the few, probably this particular last term, we did not have that. About Nathan, you were, I'm not sure, but someone from Gauteng, if it was not you, I'm not sure who was. I was one of the people that were elected by the council.
Disciplinary committee that was constituted by me.
No, wait, Chairperson. There were two, that is one separate one. There was a committee that evaluated the performance about Comrade Mark, about Comrade, about Nathan, about everyone. Then, based on the report that we had, then we came back and reported to the National Council. Meaning what we need here, if we are worried about the performance of the NWC, that we need then from time to time to have these particular committees, including the National Disciplinary Hearing Committee, which we won't call it a board. So everything that we are saying, we are all in agreement, but in different ways. The separation of powers, we are all in agreement of that. There must be that separation of power. But then in terms of evaluation, it's very, very important that there's nothing new, there's nothing wrong, and we have to do that. But then maybe then what we need to add in that particular resolution is a period. After how long do we do this evaluation? Those are the things that we need to be more specific. After 2 years, after a year, after what? Those are the things. But in terms of separation, we are very clear in terms of that. Thanks.
Thank you. Your Eastern Cape, Gauteng, and then GS.
Thank you, Chair.
I think after this deliberation, comrades, we need to close this matter.
I thought when you were mentioning Gauteng, you were calling Bobby. No, Chair, I just want to sponsor some advice in moving forward. I just copy something which the DGS have just mentioned, the Performance Evaluation Committee. I think when a chair, it should consist of provincial chairperson and secretaries.
Patrick, you are out of order. This is your last warning. Uzopuma Shem.
I think, Chair, we must have that committee, that Performance Evaluation Committee. It should consist of all provincial chairpersons and secretaries. Including the top five, the top 5 years as ex officios. In an ex officio status, they will have rights, Chair, to engage in that committee, but they will not have voting rights when the discussions are deadlocked. They won't have voting rights. Maybe we can even say that the chairperson and the GS forms part of that committee, but they don't have voting powers, just to guide and give direction where it's necessary. But
so just to provoke you, comrade, may I?
Sure.
So in case where the general secretary or the secretary, the general secretary or the chairperson are the ones who are not performing, don't you think they will influence the committee? Or the committee, it will be biased to them because they are sitting with them in the meeting. In that committee, they are forming part of that committee.
I'm being disturbed, Chairman.
Order, Comrade GS.
And I wanted to respond to that, and GS is sponsoring a view that I should reserve it for now and come back late, whilst I want to respond now.
Respond.
Out of order, leader.
He's been called on order.
Don't undermine my capacity of thinking, please.
Yes, yes.
And I'm expecting a public apology after me. No, Chair, what you're asking is correct. Ne? I think it might be open for discussion because I'm standing here, I'm not taking decision, but I was just sponsoring a view in the Congress so that the Congress can decide. If the Congress agrees with what I'm saying, that it must consist of Provincial Secretary and Chairperson, it's correct. The ones of National Chair and Secretary, that they must form part or not, it is, I'm putting it out there. The Congress can engage robustly and partially on that.
Okay.
I salute.
Thank you, leadership. Gauteng.
Siyabulela sihlalo.
Asibonge.
Siyabonga. Comrades, we don't have to panic, comrades. An organization as big as TAC doesn't have a vacuum, comrades. Earlier on, there was a comrade, I just forgot her name. She suggested that we must have a veteran structure. A veteran structure will be extremely critical and will have to give that particular structure sort of a mandate that will be able to play a role of albatross in the organization. And in what I mean, because those people, number one, have no direct material interest in the day-to-day running of the organization in terms of personal interest. Therefore, that structure ought to be adopted, in fact, should be created so that can play that particular role. Perhaps in the composition of the committee, that should be, evaluate the working of the National Working Committee. Therefore, we can incorporate maybe one, I think it will be determined by the deliberations, whether you put one member of the board and those veterans, because they don't have a direct material interest in the day-to-day modus operandi of the organization. Therefore, we can't downplay the existence of the veterans. We'll assist and will be able to bolster and have the executive authority to reprimand where from time to time comrades will be going astray. So I'm calling for that structure to be aggregated, from there be utilized in order to strengthen the organization. I hope I've not wasted your time, Kokeli.
No, you have not wasted my time.
Thank you, Chairperson.
I will give to the General Secretary.
Thank you, Chairperson. Chairperson, people are tired. Before I say what I want to say, let me apologize to you, comrade. Two, Chairperson. This is not personal, but it is political. I find the Chairperson of Gauteng confusing this Congress. TAC does not have a veteran structure. Therefore, we cannot make plans about something that was proposed and not seconded. It was just a mere proposal. Nobody seconded the issue of veteran structure, and therefore I would not like us to include the issue of the veterans in our discussions. With all due respect, Chairperson, I still maintain that I support Comrade Bobby and other comrades who said, let us remove Resolution 80. I therefore request, Chairperson, that we divide the House, we vote for those who say it must remain versus those who say we must remove it, so that we can move to the next item. Thank you.
So in that context, comrades, Let's vote. Which provinces that are saying we must remove Resolution 80?
The third part that we are saying, this resolution is correct. It's just that we need to remove the party board and then create a necessary committee that is need to deal with, because the thing here, it's a question of fear, of performance. So that it is for that reason why we're bringing the board in. So what we were saying, remove the board, create that particular structure within the organization to deal with that matter. So it is important, but remove the board. That's all what we were saying. So okay, if you are voting, consider that third part then.
So we should vote on 3 issues. Proposition number 1, it says we remove Resolution 80. Proposition number 2, it says, no. No, it's a Congress, Comrade Party. Comrade Bobby. Comrade Bobby, you are out of order. You are out of order. How do we run the Congress? It's a Congress, you are right. But how do we do it? You see? You know, comrades, it's important to say we shouldn't do things when it suits us. Agree when it suits us. When it doesn't suit us, it doesn't. I'm giving a direction as the chairperson. This matter, I think it's been over 30 minutes we've been discussing it. We have discussed it, and we cannot confuse ourselves more. Gauteng, Comrade Bobby, you have given so many chances to raise your issue. Can you give the Congress a chance to vote on these matters? So I will request the Gauteng Secretary to lower the board. I suppress you, comrade. Thank you. Comrades, there are 3 propositions on the table. 1, it says we are removing Resolution 80. Second one, it says we are keeping it, but we are removing that the responsibilities be provided to the board, but to the evaluation committee. And the third one, it was saying we should keep it. According to the discussions. So, Bobby, comrade from Gauteng, Chairperson, Gauteng Chairperson, can you please give political guidance to Comrade Secretary? Because the Secretary is out of order. And the Secretary is disrespecting the powers of the National Chairperson. Because when you are a chair, you are given a mandate and a responsibility to run the meeting. And when you are giving direction to the meeting, you need to be respected. I'm out of order. Okay.
The point of order that I'm raising, Chairperson, the rules of engagement. You raise your hand before talking. You are recognized, then you talk. And repeatedly, so Comrade Bobby is raising a hand and talk at the same time. So Comrade Bobby must come forward and apologize for his behavior and behave like any other person. All of us here, we're raising hands, you recognize us, then we talk. Thank you.
I unconditionally apologize for the behavior which is uncalled for.
Thank you.
Can you allow me to?
No.
Thank you.
Thank you, comrades. So, those provinces who are saying we should remove Resolution 80 by the show of boards, the GS, Free State, okay? There are two hands. Those who are saying we should keep this resolution with an amendment that says we should form evaluating committee by the show of boards. Limpopo, Eastern Cape, Mpumalanga, Western Cape, KwaZulu Natal, Gauteng. By the show of boards, we're no longer discussing, comrades. DGS, Limpopo, Eastern Cape, Mpumalanga, KwaZulu Natal, Gauteng, Western Cape. No, I'm no longer opening for discussion, comrades. We are voting, Manch. It's important, comrades, for people to listen to the conversation and follow the conversation and listen to instruction. Because I think the chairperson has given a fair chance on this issue. I did that deliberately because I didn't want to say, people to say we detected for them. I don't like to be a detector, comrades. But when you push me to that corner, I can be a detector. So, with amendments, I think we've captured it to say we'll have an evaluation committee. Is it captured, Comrade Loti and Buto? Okay. So, can we continue there, comrades? Comrades, please. Please, comrades. Let's respect our house rules. And you know, comrade, unfortunately, I'm one person. I hate howling because I feel disrespected. If I can howl at you while you are speaking, how will you feel? So, comrades, we mustn't do to others what we wouldn't like as that thing to be done to us. Because if I have a point, I raise my hand. I don't howl anybody. I don't see a reason why comrades have to howl me. I'm not sure, Free State, what are you raising upon? Because we just voted and we are done on this matter. I'm suppressing you, Free State, sit down. We are moving forward.
Okay.
Continue, comrade.
Thank you, comrades. Okay, we are now moving on to the board of directors. Resolution 81. Alongside adequate skills, gender balance, and adequate representation of people living with HIV and key populations shall be essential criteria when considering future appointments to the board, the organization's board.
Okay. Resolution number 81. Any additions? Opposition? Thank you. Move.
Thank you. 82. On partner organizations, TAC endorses the following organizations as members of the National Council: AMFA, Cancer Alliance, Doctors Without Borders, Health Gap, O'Neill Institute for National and Global Health Law, National Association of People Living with HIV and AIDS, People's Health Movement, Positive Action Campaign, Positive Women's Network, Rural Health Advocacy Project, Section 27, South African HIV Clinicians Society, South African Network of Religious Leaders Living with and Affected by HIV, Sanarela. Oh, and then lastly, it says, TAC National Council must develop specific criteria for potential organizations that wish to partner with TAC and for membership of the NC. These criteria must look at the objectives of the organization and whether they are aligned with TAC within the first 2 National Council meetings. However, if partner organizations are in conflict with TAC's missions, mission, partnership can be terminated.
Additions? You are right. No additions, no comments. I do have a comment on this. Can you go down? Up? I think on resolution 82, it should say TAC endorses the following organization as members of the council per invite. Because if we are saying members of the National Council, it will mean in every National Council will have to meet them. So they will only come to the National Council per invite. That is my submission. Supported by the DGS, Limpopo, Eastern Cape, General Secretary, HIV sector, LGBTI sector, men's sector, Free State, Mpumalanga, Western Cape, KwaZulu-Natal, and Gauteng. Thank you very much. On another issue, okay? Okay, you can come in on another issue. Yeah, I wanted to fix that first sentence. We endorsed it. So we want to come on this. It's something different from what we are doing here. Before you speak.
Yes, but it's in line with amendments of the Constitution.
Oh, okay.
If we turn to page 11, 9.5, in 2020, Chairperson, the National Council amended the Constitution. That clause reads as follows: no leader of TAC governance structures shall serve in elected position in political parties. We amended the Constitution as the National Council, but that was not approved by the National Congress. I submit that the National Congress approves that clause in the Constitution. That is my first submission.
Thank you. Imaganjalo in the first submission yako. So, okay, it's resolution 9.5. This resolution was adopted by the National Council as the highest decision body in between Congresses. So, the General Secretary is asking the Congress to endorse this resolution. Because it's not discussed. It was never discussed in branches. No one came here with the mandate from branches of this resolution. So we cannot discuss it. Because it's here and it was adopted by the highest decision body in between Congresses. So now we are giving the highest decision body a platform to endorse this resolution. Gauteng? Bobby, don't intimidate Comrade Chairperson. No, but we are raising a point. We are raising a point, and then he wants you to put down your hand in front of my eyes.
Chairperson.
Okay. Free State. Oh. Free State, are you supporting this item? Free State, DGS, men's sector, LGBTQIA, HIV sector, Limpopo, Mpumalanga, Western Cape, Eastern Cape. So, by virtue of majority vote, this issue is endorsed by the Congress.
Thank you.
Second issue.
Thank you, Chairperson. The other thing, Chairperson, that Upop is still talking, Chairperson.
Comrades, you know we have other responsibilities that we need to do. And I'm worried because before this Congress ends, we need to have a group vote. And ilanga liyashona ngaphandle. We won't be able to have a group vote. So, ngicela si push in. We still have messages of support. We still have acceptance speech.
Chairperson, 2019, the board gave us a mandate to go to TAC branches and ask TAC branches, how many terms of office must a leader serve in the governance structures of TAC, irrespective of the position one is holding. The TAC branches gave a mandate to the National Council to say, at any level, leaders will lead for 3 terms, not more than 3 terms, and then they vacate the office. Can we also endorse that and include it in the Constitution? Thank you.
I don't have to explain it. I think we had it, comrades, and we discussed it. Gauteng, are you supporting? Gauteng is supporting. Eastern Cape, Free State, KwaZulu-Natal, Limpopo, DGS, men's sector, LGBTQIA, HIV sector, GS, Western Cape. Thank you. By virtue of majority, it is endorsed.
What number?
Huh?
What number was it?
Konjo, which number is it?
Okay.
Not more than 3 times. Okay, so, comrades, all the resolutions of the 7th National Congress are adopted by this Congress. Thank you very much for the hard session you gave me. But I want to congratulate you, comrades, on the deliberations. It was exciting to see such deliberations within the Congress. But next time we want to see more people. And when we do these deliberations next time, can we respect the house rules? And don't disrespect each other. Because, comrades, honestly, there are things that some of us can tolerate. There are things that we cannot tolerate. There is a line when a person that draws to say, I can go up to this far. Once you jump this line, I can. So, but we are not threatening each other. It's just that a way of respect. That is why they are saying respect is a two-way. So that singa jumpile line, So, comrades, what I will ask us to do now, quickly, we take our placards, go out, siyoba ne national group photo, National Congress group photo, manje. And then, what time is it? 10 to 6. So 6:05, we need to be back. Yes, comrades. Unfortunately, we have to end this Congress today. And we adopted the agenda, so we have to finish all the issues on the agenda.
Abaphelele. Yeah, as a team.
Just one for the last time, manje. This one is for home. Hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Hawe ma hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Hawe ma Ovalu valu tololo. Ovalu valu tololo. Hulente siyenzayo. Awusukume man, awu. This one's for taking home much. Hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Hawe ma Ovalu valu tololo. Ovalu valu tololo. Hulente siyenzayo. Hawovome moya wa. Hawovome moya wa. Hawovome moya wa. Hawe ma Hawovome moya wa. Hawovome moya wa. Hawuvombi moya wa. Hawe ma lente siyenzayo. Kulente siyenzayo. Awusuku kulente siyenzayo. Hawe ma hulente siyenzayo. Hulente siyenzayo. Hulente siyenzayo. Hawe ma Ovalu valu tololo. Ovalu valu tololo. Hulente siyenzayo. Hawe ma Hawovome moya wa. Hawovome moya wa. Hawovome moya wa. Sambe. Sambe. Hawovome. Hawovome moya wa. Asam. Svome moya wa. Hawuvumi moya wa. Hawe ma. Vuma man. Hawuvumi moya wa. Hawuvumi moya wa. Hawuvumi moya wa. Krpa. Oma. Hawuvumi. Hawuvumi moya wa. Uyavuma umoya, uyavuma. Vumi moya wa. Bayathokoza vumi moya wa. Hawe ma. Oh, asekuliwe, hiyo, sekuliwe, hiyo, esadubule seyabham. Sashoka mnandi, hiyo, ashoka mnandi, hiyo, osadu. Hathi ngoba sekuliwe, hiyo, sekuliwe, hiyo, osadubule sabham. Sashoka mnandi, sashoka mnandi, osatu hamagwala sobale, asobale, osatu bolesapha. Sashoka mnandi, sashoka mnandi, osatu hathi ngoba sekuliwe, sekuliwe, osatu bolesapha. Sashoka mnandi, sashoka mnandi, osatubu amagwala sobale, asobale, asatubule sepha. Sashoka mnandi, sashoka mnandi, yo satu. Hathi thetha nobhala, thetha nobhala, osatubule sepha. Sashoka mnandi, sashoka mnandi, osatu. Hathi thetha wesibongile, wesibongile, yo osatubule sapha. Sashoka mnandi, ashoka mnandi, osatu hamagwala sobale, asobale, osatubule sepha. Sashoka mnandi, sashoka mnandi, osatu hathi ngoba sekuliwe, osekuliwe, osadubule sepha. Sashoka mnandi, sashoka mnandi, osatubule. Shwele sekuliwe, sekuliwe. Sashoka mnandi, sashoka mnandi. Teki sekuliwe, sekuliwe. Sashoka mnandi, sashoka mnandi. Amagwala sobale, asobale. Asobaleka, asobaleka. Thetha nobhala, thetha nobhala. Sashoka mnandi, sashoka mnandi. Amagwala sobale, asobale. Sashoka mnandi, sashoka mnandi. Shwele sekuliwe, sekuliwe. Sashoka mnandi, sashoka mnandi. Shwele sekuliwe, sekuliwe. Sashoka mnandi, sashoka mnandi. Amafaka asobale, asobale. Sashoka mnandi, sashoka mnandi. Thetha nobhala, thetha nobhala.
Sashoga mnandi, sashoga mnandi. Teta no pala, teta no pala. Sashoga mnandi, sashoga mnandi. Teta no pala, teta no pala. Sashoga mnandi, sashoga mnandi. Amakwala sobale, asobale, asobalega, asobalega. Mansa, uyabona simanyobo nyobo. Uthe kasofundisa abasha. Uyabona simanyobo nyobo. Hagenebe senuthe kasofundisa abasha. Sishuthe, uthek hagen. Henuthe kasofundisa abasha.
Patrick, hlala phansi.
Hayi moral.
Patrick, hlala phansi.
Awuhlale phansi ubambe umthetho. Awuhlale phansi ubambe umthetho. Hlala phansi. Hlala phansi. Hlala phansi. Hlala phansi.
Amandla. 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 Thank you. Thank you, comrades. Can we please be seated? We are left with a few minutes before we officially close the 7th National Congress of TAC. What is going to happen now? We're gonna play videos of messages of support, and then after that, we will hand over to the newly elected National Chairperson of TAC to deliver an acceptance speech on behalf of the newly elected National Working Committee members. So let's shoot straight to the messages of support, and then we will take it from there. Thank you.
Hi, comrades. My name is Tandima Luka from Positive Women's Network. I'm the Deputy Chairperson for HIV sector nationally. I'd like to thank Treatment Action Campaign for saving my life. If it was not for TAC, I could have died long time, but because of TAC, I'm still alive and a granny. You also teach us about treatment literacy, advocacy, and leadership skills. Some of our comrades are working outside the country because of the knowledge that you have given to us. I wish you all the best and a successful Congress and the new strategy for HIV, TB, STI. Aluta continua. Amanda.
Hello, TAC. I'm Sharon Ann Lynch with the O'Neill Institute. It has been inspiring to watch your work over the last 20 years and an honor to walk alongside of you. Ahead of your Congress, more challenges have arisen and the old challenges remain. As you deliberate strategies to reduce HIV deaths, AIDS deaths, TB deaths, and reduce injustice, I would like for us to think about what Dr. Peter Mugeni said, that there aren't two sciences. There's not a science for the global north and for the global south. There's not one science for the rich and one for the poor, one for the well-off and one for the marginalized. There's only one science. And yet today, as I'm speaking, not a single monkeypox vaccine has landed or been developed or manufactured or administered in Africa. People continue to die needlessly and painfully of cryptococcal meningitis because optimal treatment is out of reach. You know what there is to do, but you also know how your actions have made such an impact in South Africa, and I hope you know the reverberations that you have had in the region and around the world. You continue to fight, to inspire. Viva TAC, viva!
Hello, this is Polly from iBase, wishing you a fantastic and very productive Congress. We've been collaborating with TAC for many, I think 20 years now, most recently on the Modern Art Project, which seems to be going from strength to strength.
Sanwanani TAC, this is Namata and Maha, because +1. This is just a message to support you guys and obviously say good luck for your Congress and good luck for all the hard work that you are yet to do. The country needs you. We are in a better place because of you. Your activism is always required. Your fire is always required, and you guys should not rest. I mean, I wish you did have some rest, but we have a lot of work to do and nobody else is better placed to do it other than you. Indlelendlela Maqabane. Please continue doing what you do best.
Hey, good morning, everybody. I'm just taking a minute. I'm letting the chickens out and to send a message before I start work to everybody at the TAC Congress. I hope you have an incredible meeting. The work that we do here in the UK is completely inspired by the work that you guys have pioneered. When we work with patients and we talk about how you can make change happen, we show them what TAC has done. And so it's a real privilege and an honour to be sharing this message with you. I hope you have an incredible meeting, make great plans and come up with a cracking set of tactics to hold the power, those in power to account, to win universal, just healthcare for all. Because we're looking to you for inspiration and we will do that for years to come. Thanks so much for your leadership and best of luck with your meeting.
Hello, comrades of the Treatment Action Campaign. I send you my greetings and the solidarity of the Joint United Nations Program on HIV/AIDS for your 7th National Congress. You, the activists of the HIV movement, have been critical to every achievement we have made on AIDS and even beyond. It was you who stood together with hundreds of thousands in the streets when you faced denialism from the government. And you fought until today. The South African government is a global leader on AIDS. It was you who faced down the pharmaceutical companies until they agreed to allow generic antiretrovirals. You set off a revolution that now means 28 million people are now having access to cutting-edge medicines. And now it is you again who are organizing the users of the public healthcare system into a powerful political force for free, high-quality public services that meet the needs of all people as a human right. Well, while the doctors and the funders will want to claim credit, we know that it will have to be through activism, like tax activism, that will get treatment to all those who need it. At UNAIDS, we are proud to stand with you as partners. I was honored to visit Rishidze when I had just arrived to take my role at UNAIDS. I was impressed by the work that you were doing to challenge service providers to deliver services in dignity for people living with HIV. UNAIDS is proud to be your partner in that effort of leading community-led monitoring, and you have led this around the world. So today I salute you. I know that the decisions you're going to make at this conference will have an impact around the world, as your work has done for so long now. I wish you all the best. Amandla.
I think that was the last video. So, on that note, I will call upon the newly elected chairperson of TAC to deliver the acceptance speech on behalf of the National Working Committee members. Patrick, ungamphamisa ngengoma.
Amandla. Amandla. Thank you, Comrade Marvelous. I like that song. Good evening, comrades. It is with great honor and privilege to stand before you as part of the new leadership. As we had 3 days of deliberations, messages of support, this has gave us space to reflect deeply on the work that we are doing as organization, and also gave us space to tap ourselves on the back on the work that we are doing as an organization. I would like to applaud most of the comrades again, as I did when I was opening the Congress. I didn't know that I'll be the one also closing the Congress. But I want to thank comrades who are working tirelessly in improving access to healthcare services for our poor people on the ground. To all our branches, leadership, staff across the country, we recognize you, comrades. We are doing very well. We are the beating heart of TAC. Without you, TAC will never exist. However, as we are closing this Congress and going back to our provinces and branches, we need to remember that we still have a lot to do in advocating for better healthcare services. We need to remember that poor communities are still living in conditions that are not conducive and are becoming poorer and poorer. We need to remember that key populations, their rights are still violated. Irrespective of us taking resolutions on this Congress, it's also up to us to go back to to our branches and communicate these resolutions and make these resolutions to be an action. And we need to do that with passion and advocate for the rights of the population. Comrades, the issues of gender-based violence and femicide are at a center stage of our lives in communities. And unfortunately, no one of us is immune from this, especially women, children, key populations. Not saying that men are not raped. We know that there are men who are raped. But their number, or the data shows us that the people that I just counted are the ones who are most at risk. Therefore, it is our responsibility as Treatment Action Campaign to also respond to those issues. When people are raped, they don't get PEP. Our Tutuzela centers are no longer functional as they were. And we are quiet as Treatment Action Campaign. We need to go back to our communities, be active, and fight gender-based violence. In the morning, we deliberated on the issues of gender-based violence, and we agreed, or we resolute that TAC men will lead in fighting gender-based violence. And TAC will never tolerate any type of harassment. We need to see that in action. Matot, you've been saying you are protecting us for a very long time. It's time for you to show that you really mean what you always say. It's time for you to stand up against any form of gender-based violence and femicide. It's time for you, when you see that a woman is violated, and stop another man and say, you cannot do this, not on my watch. As the men slogan, mostly they say, not in my name, but it continues to happen in their name. So we are tired as women to just hear you talking. We need to see action. And it needs to start with TAC. It needs to start with TAC. I think from the messages of support, comrades, we have realized that TAC's role has never been more important than before. All the people who are sending us messages of support, they remind us of our role. They remind us of the importance of this glorious movement. And as this Congress, 7th National Congress, has resolute that we are going to build this organization to be a mass movement, I believe you, comrades. And I believe that that resolution will be carried, and that mandate will be taken to branches. We'll see growth of branches. But mostly important, comrades, it's important to bring back the power of branches. Let's allow branches to have a voice. Let us not be gatekeepers of information. Let us not be gatekeepers of growth within the organization.
we need to acknowledge that Treatment Action Campaign is a university. It's a university. As much as we don't have accreditation, but if you are serious about the programs of TAC, you are taking treatment literacy serious, you become a doctor. You go to the consulting room, as the doctor will come and say, I suspect this, already you have your own suspicions because you know side effects. We are an information hub of the community. Communities, when they need information, they need to come to us. In this Congress, comrades, we spoke at length about the code of conduct of TAC members in our communities. And we agreed that as a TAC member, you need to represent TAC at all times. So therefore, what does that mean? You don't have your own time. You are the face of your organization. Whether it's in the dark, whether it's in the light, what you do, it will reflect the organization, whether it's bad or whether it's good. Comrades, we need to make sure that national health insurance is implemented, but not just implemented. We need the NHI that we were promised. We need to challenge the bill if it's not coming in a form that it was promised. We need to challenge the bill if the bill will come xenophobic and excluding other people who are living in South Africa. When I'm saying people who are living in South Africa, I'm talking about our brothers, African brothers. We are all Africans. I'm talking about children who are born in South Africa who don't have identities. That is another form of violation that we don't talk about. And we know that in one way or another, children are born in South Africa. And irregardless who gave birth to that child, but for the fact that the child is born in South Africa, is a South African. So those children, we need to advocate for them to get identity, so that they will enjoy the rights of being South Africans and Africans. Comrades, as I'm closing, because I know that we have taken so much time, but this Congress has agreed on community-led monitoring, that TAC will engage on community-led monitoring. And I think we discussed it at length to say, how are we going to do it? Starting from tomorrow, moving forward, we are expecting to see TAC doing community-led monitoring. When we go to Comcare dashboard, we need to see outcomes. We need to see work happening, because that's the only way we'll see that we are doing community monitoring. Comrades, TAC, it's known for holding those who are in power accountable, especially the government. But internally, we have become oppressors. Internally, we are scared to hold each other accountable because of different reasons. Sometimes it's because of the systems that we created. In some cases, it's because of the positions that we are holding. We think we are better than others. At some point, we discriminate each other on how are we educated or uneducated? And our code of conduct and our constitution, it's clear, comrades. TAC doesn't discriminate. TAC doesn't discriminate. It is our role, comrades, to go to those people who are uneducated and educate them. And give them confidence to be able to speak out when there's any form of human rights violation against them. We agreed that we are going to build local activism. When we are saying that, we mean our communities need to be able to respond to the issues that affects them. It can be individually or as community. So as we are ending this 7th National Congress and starting another journey, comrades, let us take it upon us, all of us, to make sure that we always do self-introspection to say, I am still relevant to TAC. Am I still towing the line of TAC? I am still following the code of conduct, the constitution of TAC, or I am becoming a law into myself. I think I'm better than anyone. In TAC, comrades, there's no one who's better than anyone. You can hold a national position, but we are all treated equally. And that equalness needs to be seen. This thing of resources being not available for branches to do their activities, it must come to an end. It must come to an end. Branches need to get their resources as required. While as branches, we follow all due processes because we agreed to say we are not going to tolerate any form of corruption internally and externally. Our autonomy as branches, we need to claim it back, comrades. No one should decide what we need to do. Our community-led data needs to decide for us because it will tell us what are the situations on the ground, and it will tell us how to respond to these issues. And if it takes TAC to toy against TAC, let it be. Let it be. Why are we scared to raise our voices inside, internally? But externally, we are able to raise our voices. Isilungu sithi, comrades, charity begins at home. Inhlonipho ifunde ekhaya. If la ekhaya sikufundisa ukuthi advocate. If la ekhaya sikufundisa ukuthi ube principled, be principled. If la ekhaya sikufundisa ukuthi ungathathi any form of violations, don't. Don't. Put your foot down. So, comrades, as I'm closing this National Congress and accepting, the leadership is accepting this responsibility that you have provided to us. We know that we are people of different characters and we have different minds, and all of us, we are independent thinkers. It won't be easy to take TAC to another level. But with your support, with your guidance, we will be able to do so. The rise and the fall of TAC, it's in your hands. The rise and the fall of this leadership that you've elected and celebrated that you won,
It's in your hands. You are the one who are going to destroy this leadership. But let me warn those who are appointing or electing people to set them for a failure. This time you have gone wrong. That is not going to happen. This leadership will work. Each and every member of this leadership will work. And if they don't want to work, whether resolutions you have taken or not, the National Council will have to decide. If the National Council doesn't decide, unfortunately, if we have to find resources to go back branch to branch and tell branches that you've elected people who are lazy, let it be. If the board of directors has to take a decision, whether we like it or not, as they are legally protecting this organization, they will have to take that resolution if we are not doing our work. So, comrades, I welcome you. These seats are not comfortable, are hot. Ziyashisa lezi hlalo abasinikeze zona. Bonile bebasaga kanjani? Basijabulele. Bazosi-attack ngale ndlela. Ngale ndlela bebesihaga ngayo. Ama-attacks mawavela azovela ngale ndlela. But one thing ezokwenza ukuthi siphumelele ukuba united nokuba neqiniso. That is the only thing ezosenza ukuthi sikwazi ukusebenza. But if sizofuna to go ukuya emva komunye sistebhane to backstep each other, unfortunately, we'll be killing ourselves and our careers. If you think you are going to ride on my back, unyuke, be careful ukuthi ungagobuwe. Because while you are standing here, uzobe ungena balance. Once ugoba ngithi uzowa. And mawuwa la uzofuna blame somebody else. So be careful, comrades. And then we need to be careful, comrades, of tendencies of political parties that we are bringing in this organization. TAC is not a political party. TAC is a mass movement. So we cannot take a political party's ideology and want to exercise it in the TAC. When I belong to a political party, I will do so in my political party. But once I enter Congress, TAC premises, or doing the TAC work, I need to be mindful that I'm no longer a political party now. I'm representing communities. So it is important, comrade, not to forget that. But also, as I'm sitting down, Comrade Sharon challenged us. She asked us to say, what is the plan of TAC towards the 2024 elections? What are we saying about that? She asked us to say, what are we saying in terms of xenophobia? And she urged us to join organizations that are fighting xenophobia. And we are expecting every member to be active in those communities or in those structures. In those words, comrades, let me thank you and wish you safe travels home. Hope everyone will arrive at home safely tomorrow. Hope tonight you'll sleep well and rest, knowing that the mandate that you've been given by the branches, you have carried it to this Congress and you have fulfilled your mandate. With those words, comrades, I say thank you very much. Thank you for giving us this opportunity and responsibility. Okay. Amandla! Amandla! Ilo moral, comrades. Amandla! Amandla! Thank you. Comrade Ngobile, as an announcement.
It's about transport. About transport, and then into amasweta they are still on the way are coming. So as they come, I will contact the chairpersons, and then the chairpersons will.
Okay. And then okay. So Amandla, Amandla, comrades, as we are going back to our homes and houses, please let's contact Ukato ngama transport arrangements, ne? Those abazazi yobana bafidinga ama transport and arrangements and all those things. Dimakato mtawung nangia. We know that there are provinces that didn't get a sweater. They are still on the way. Azofika namhlanje. As soon as afika, they will contact your chairpersons, and your chairpersons will let you know ukuthi nizowalanda kuphi. Dinner is served at our usual place. So, comrades, I declare this Congress, 7th National TAC Congress adjourned. Amandla.